was about 6 or 7, I came home and things were being moved out of our house. I got packed into a car and I was just sped off into the unknown. And that's when my life just started slowly unraveling.
It was the two of us, our suitcases, in our car. It's gonna be okay, we're gonna have dinner tonight, I'll work something out. But every single day that I dropped him off at school, I would literally just panic.
It's not our choice to be homeless. We wanted to be out of that situation, but we couldn't get out.
It was hard to figure out where I was gonna get my next meal, where I was gonna take a shower, where I was gonna wash my clothes. I never had to think about any of that before.
We went to a shelter, and then we went to another shelter. We moved back with my grandma, and we moved again to another shelter, back and forth. There was no stability.
Every day, my mom would be on the phones trying to get help. My dad would be at labor ready. We all tried our best to get out.
I was looking for shelters or whatever I could find, somewhere to sleep with my kids all day, every day, from sun up to sundown.
It took 5 months to be able to just get an interview to then go forth with the process. There is no room. There are so many people in need, and there's just not enough resources.
Homeless people are just regular, everyday people that got dealt a sad set of cards. They don't think about drugs or alcohol. They think about, like, what am I gonna do for my family? How are my kids gonna go to school the next day? How am I gonna make this better for us?
The worst day was finding out that we weren't gonna have anywhere to be. The best day was when I got my keys here.
When my mom and dad got the keys to our apartment, it was like she would jingle them. And my youngest sister, she was like, "We have the keys, we have the keys." You weren't sure if it was real. And then, like, every time the keys would jingle, it'd be like, yeah, this is for us.
I look at my home and I see how much I have. I have a computer of my own. I have my old piano that's worth maybe $10. I'm optimistic now. When I look back, I can hear all the songs that I played in my head while I was homeless. Other people may have more, but a lot of people have less.
We got into this apartment on December 8th, just before the holidays, and that was my whole goal, is just to be able to have a tree that I could decorate so my son could feel like we have landed on our feet again.
I don't want my children to ever end up in the situation that we were in. I want them to have a better life.
I was able to open the door for my mom. I thought everything behind that door is ours. It doesn't belong to anybody else. It's home.
Hello, everyone. My name is Mark Sussman, and I have the great honor of serving as the CEO of the Bill and Melinda Gates Foundation. On behalf of everyone here at the Foundation, I would like to welcome you to a decade of innovation, lessons learned from the Puget Sound Family Homelessness Initiative. When Bill Gates Sr. passed away on September 14th last year, our community lost one of its major champions for the thousands of families and children who experience homelessness in the Puget Sound every year. Bill Sr. launched the Washington State Team's Family Homeless Initiative back in 2000, following an extensive strategy development process conducted with the University of Washington School of Social Work that concluded in our local community, homelessness loomed as one of the most significant barriers for children and their families to have the opportunity to live a healthy and productive life. For the past 20 years, led by Bill Sr.'s commitment to the cause of ending homelessness, our team has worked with so many of you, providers, policymakers, advocates, researchers throughout the Puget Sound region to provide meaningful solutions for families experiencing housing instability, so that the children growing up in these families never experience homelessness again as adults. We are proud of all the progress we've managed to achieve together, and we are excited to be gathering with all of you today to share what we've learned. We know there are many cynics in our community who continue to believe that we cannot do anything about homelessness, that government is wasting money, that the public sector can never innovate or learn. But we know this view is wrong. Our convening today proves, through rigorous evaluation and hard data, that over the past decade, our communities have almost doubled the number of families that find permanent housing after experiencing homelessness. Together, we have learned and innovated and improved. As a result, many thousands more families experiencing homelessness have permanent housing than would have had without our efforts. We, of course, cannot be too celebratory. The homelessness problem has only gotten worse over the past decade, as economic inequality and systemic racism and the lack of affordable housing in our communities push more and more families into homelessness. There is so much more we can do, and we must recommit ourselves to redoubling our efforts to make our communities more welcoming to those in need. But especially in times when the problem seems to be getting worse, I believe it is more important than ever to point to how we've learned, how we've innovated, and how we've made progress together. We know we can solve homelessness. We just need to have the collective will to do so. Bill Sr. believed strongly in our region's ability to come together to solve complex problems together, and we have been honored to support this important work over the years. Thanks so much to all of you for being a part of the Family Homelessness Initiative, and we hope you will enjoy this convening.
We're here. We show up. We fight every day for what we know to be true. Because we know that a family living in a shelter isn't just the way it is. We know that the backseat of a car should never be a child's bedroom. We know that the system can change, that it's worth putting in the work, that we can make life better for those in need. Because over the last 10 years, our communities have learned together, innovated together, improved together. And today, we're moving more families experiencing homelessness into permanent housing more quickly than ever before.
Through the Family Homelessness Initiative, we've changed the housing crisis response systems to better serve families experiencing homelessness. And we've put a greater emphasis on meeting the needs of African American and Native American families who are disproportionately impacted by homelessness in our region.
We've been listening carefully to families and what they say they really need to move into stable housing. We've been redesigning programs to meet those needs and have re-engineered our data systems in order to be able to look at that information in real time to see if we're helping families meet those needs and achieve their goals.
As a result, we've doubled the number of families moving into permanent housing and have reduced the amount of time it takes for families to find that housing. And yet the hard truth remains that even as we've made progress, an even greater number of families have fallen into homelessness during this same time.
So while there is progress to be proud of, there is so much more to do, especially during this time of COVID. And now is the time to redouble our efforts. Because we know that we can solve homelessness. We know that racial equity must be foundational to everything we do. We know that we need to build more affordable housing fast. We know that for our solutions to be successful, our funding must be flexible. And we know that putting housing first is the fastest way to transform a homeless family into a family with a home. We know what to do. We know how to do it. Now is the time to make sure that every family is secure, feels safe, and has a brighter future. Now is the time for every family, every parent, every child to know a home of their own.
Well, good morning, everyone. My name is Colin Min, and I'll be serving as your host and MC of sorts for today's convening. For those of you who I haven't met, I'm a senior program officer at the Bill and Melinda Gates Foundation here in Seattle. And for the past 12 years, I've had the great fortune to be a part of the foundation's family homelessness team. And I'm really excited to be wearing work clothes for the first time in almost a year, and to be hosting today's event, which represents the culmination of more than a decade of work that so many of you on this call have been a part of. So I want to start with the obvious, which is the awkwardness of trying to host a virtual convening for more than 400 people. And in case you're curious, we have approximately 450 people registered for this convening, and about half of you are from the Puget Sound region in Washington State, and the other half are from jurisdictions around the country. And I just took a look at the list, and it's an incredible mix of providers, government officials, people with lived experience, private funders, researchers, and advocates, all dedicated to the goal of ending homelessness. And when we started planning this event over a year ago, our hope was to invite everyone to the foundation here in Seattle for a 2-day gathering where we could meet in person one last time and enjoy some of the apparently famous bacon for which our convenings are known. But unfortunately, COVID being what it is, this isn't possible. And so while we can never replicate the experience of an in-person convening, we've done our very best to design a virtual convening that is fast-paced, that has a lot of breaks, and that will tell the story of the initiative from as many different perspectives as possible, because we recognize that we're asking a lot from you to attend a full-day virtual convening. So we encourage you to send your questions to our speakers using the chat box to the Q&A moderator. And while it might be a challenge getting to all of those questions during the plenary sessions, we have built in plenty of time for 11 different breakout sessions this afternoon. You all will have a choice to attend 2 of those sessions. And we think that those smaller breakout sessions will be great opportunities to answer your questions, have small group discussions and conversations. And so we really hope that you'll stick around and participate in those breakout sessions as well. Now, even though our convening is virtual, we are all each individually located in and benefit from specific places that were originally inhabited by Indigenous people. And so with this in mind, I'd like to offer a simple tribal land acknowledgement to start our convening. And if you go to the website on the slide that will be presented shortly, that's nativeland.ca, you can type in your own location to find out whose ancestral lands you currently inhabit. So I'm currently located in Seattle, Washington, and would like to acknowledge that we in the greater Seattle area live, thrive, and benefit from the unceded and traditional territory of the Duwamish, Muckleshoot, Suquamish, and Coast Salish people. And this acknowledgement, of course, doesn't take the place of developing authentic relationships with Indigenous communities, but instead serves as a first step in honoring the land that we occupy and in resisting the erasure of Indigenous past, present, and future. And so I hope you'll take a minute to similarly acknowledge the people who originally inhabited the land that you're on today, wherever you are, and to recognize the ways in which you benefit from that occupation. And incidentally, one of the things that we're very proud of is that over the past decade, there's been a huge improvement in the way that we provide housing and services to Native and Indigenous families experiencing homelessness here in the Puget Sound. And we're really excited that you'll have the opportunity today to learn more about that work from some amazing leaders. Now, before I get started, I want to encourage you all to visit the Gates Foundation Family Homelessness website that was included in your invitations. And in addition to finding an agenda and a speakers directory for today, this website also contains an archive of many of the key documents that we'll be discussing. It contains all of the WestStat longitudinal evaluations that have been published to date, as well as a white paper recently published by the Foundation that summarizes many of the key lessons that stakeholders who have been involved in the initiative over the years have lifted up for us as the key learnings that they would emphasize for others seeking to learn from our work. And I wanted to lift up a couple of key lessons from this white paper that will be consistent themes that you'll hear throughout today's convening. So first, by working together in new ways, our community succeeded in improving the way that our crisis response systems move families into permanent housing. In fact, over the past decade in King, Pierce, and Snohomish counties, we've doubled the number of families that move into permanent housing, and we've shortened the amount of time that families experience homelessness. And this is a major accomplishment that we should be proud of. It demonstrates real progress. And as Mark Sussman, our CEO, said earlier, it dispels the very harmful myth that government money is being wasted or that government can't innovate or improve when it comes to homelessness. Now, at the same time, we all know that these improvements that we've seen in outflow over the past decade only tells half the story. The hard reality is that even as we've improved our crisis response systems, the rate of inflow during this same time has increased at an even greater rate. The problem of homelessness in the Puget Sound region now is largely one of inflow. And in order to solve this problem, we need to move upstream to really address the root causes of what's driving families into homelessness in the first place. And these are big issues that our communities have never fully addressed, like the tremendous lack of affordable housing in many of our communities and the entrenched systemic racism that prevents so many Black and brown families from advancing in today's economy. Which brings me to one final bit of context. During today's convening, while we certainly will be talking about the ways that our communities have improved over the years, we also want to be equally transparent about what we wish we had done differently. And there are two topics in this regard that parallel what I just mentioned regarding the root causes of homelessness. The first is around the topic of race and the need for targeted interventions and disaggregated data and a renewed sense of housing justice to address the racial inequities that we know underlie homelessness. We all were slow out of the gate recognizing the need to center racial equity in our strategy. And so you'll hear discussion at every one of our panel presentations today about how our communities pivoted mid-implementation to try to make racial equity a more central component of our work. And the other topic that we'll focus some discussion on is the need to build affordable housing at scale, because it's becoming increasingly clear that without major investments in housing at a scale that we're not even contemplating at the moment, we're never going to end homelessness the way that we would like to. So with that, let's get started. We wanted to start off the convening today with a little history about the Puget Sound Family Homelessness Initiative. How did it come about? What was it trying to accomplish? And what was its original theory of change? So to help us answer these questions, I'm really excited to introduce my former colleague and friend from the Bill and Melinda Gates Foundation, David Wertheimer. So welcome, David.
Thank you, Colin. It's good to be here. Hello, everybody.
David, thank you for allowing us to drag you out of quasi-retirement to be here with us. We really appreciate it.
Great to be here.
So David, you were a big part of the development of the strategy that Bill and Melinda Gates approved to address family homelessness in the Puget Sound region. Can you tell us about why the Gates family decided to launch this initiative in the first place and what the foundation hoped to accomplish?
Sure, Colin. As you know, as Mark said, it really was Bill Sr.'s vision that launched this strategy. Even before my time at the foundation, which started in 2006, Bill Sr. and the co-chairs, Bill and Melinda, came to the Pacific Northwest team and said, what are the biggest issues we need to address here in our local community? How can we have an impact here? And they were presented with a variety of the co-chairs, and Bill Sr. were presented with a variety of different options. And they landed on family homelessness because they realized that without a home, families couldn't thrive. And the foundation's work globally is largely about helping families thrive. So kids can't succeed at school, parents can't succeed at work, a stable home environment for children and families and their parents to live in and thrive in was not possible. So early on, it was Bill Sr. and the co-chairs who said, let's focus on family homelessness in our immediate backyard.
And so can you say a little bit more about how the strategy was actually developed and what the foundation hoped to accomplish, given the co-chair's interest in these families?
Sure. Well, you know, the first set of investments that were made were something called the Sound Families Initiative, which created about 1,400 and almost 1,450 units of transitional housing. But that model really was in some ways problematic because transitional housing really was the question is transition to what? Where is the permanent housing and a housing readiness approach as opposed to a housing first approach. So in 2006, when I joined the foundation, we really decided to rethink that approach and to look at what would be required to create a system of care that was based on a housing first approach that immediately would take families that were in crisis and place them in permanent rather than transitional housing or shelter. And what we encountered, what we discovered was actually quite fascinating, thanks to the remarkable research that Westat did longitudinally across the whole evaluation. At our baseline cohort, that is the families that were coming into the system before the changes of the family homelessness strategy were implemented, we found in one of the counties, and I won't name which county it was, the average number of phone calls that primarily a mom, because most homeless families are headed by single moms, the number of phone calls she had to make before she could find a provider that could say, maybe I can help you, was 45 phone calls. Now, I asked the 272 people currently on this call, how many of you would make 45 phone calls in order to get the assistance you need to help your family thrive? At what point would you just give up? At what point would you say, this system is so broken, there's no way for me to find the help I need? So we decided it was really important to try and create a system of care in the 3 target counties, King, Pierce, and Snohomish counties, and to create a system that responded to each family's precise needs as best it could, not a one-size-fits-all model, but a tailored approach to families that was focused on the 5 pillars, which I think everybody knows, of coordinated entry, prevention, rapid rehousing, tailored programs and services, and linkages to economic opportunity, with a foundation under those pillars of developing organizational capacity, a real system of care, data and evaluation, and advocacy for families that were experiencing homelessness. And that really was the foundation for the new strategy, that with partners in the community, at the county level, at the provider level, our evaluators at Westat, and our intermediary partner Building Changes, which through its work really helped to each of the counties to apply the theory of change in ways that each county decided was most appropriate, but also was consistent to the underlying approach the foundation wanted to test.
Great. And can you also talk a little bit, I mean, the terms that we're talking about family homelessness, homelessness in general now, we talk about the concepts of inflow and outflow. Did those concepts exist at the time that the strategy was developed? And even if they weren't in common usage, can you talk a little bit about what this strategy was really trying to accomplish within the frames of those concepts?
Yeah, I don't think we were talking specifically about inflow and outflow, but I think we were, from the very earliest days of the strategy, warned by some of our partners, particularly those partners that were running housing authorities, that we were missing the 6th pillar, which they said was permanent housing. Who is going to provide the permanent housing that the families flowing through the homelessness system need at the end? Now, the resources that the Gates Foundation had were insufficient to create the housing supply we needed. We spent $40 million during Sound Families and created 1,445 units. So we did not offer a solution to that problem, which I think was one of the challenges that we faced throughout the whole strategy was, where's the 6th pillar? Where is the permanent housing supply that these families need to thrive?
Yeah, and so you're starting to touch upon kind of some of the direction that I want to go is, you know, we obviously 10 years later haven't solved family homelessness. The problem seems to be worse than ever. So can you continue reflecting on, you know, what did we miss? I mean, what should we have done differently? Because I think even with the success that you're describing about the way that we've seen improvements in terms of the number of families that flow out of the crisis response system, clearly we were not looking at the whole problem holistically enough to really address the problem at the scale that it needed to be.
I agree completely. And, you know, I think as I reflected on this over many, many years, I've started to use one of the metaphors that the Gates Foundation uses in a lot of its work related to health. A lot of its work globally is health-related work. And I think one of the challenges we faced in our family homelessness strategy was we were treating the symptoms and not the diseases. So the symptoms are things like homelessness. The symptoms of the diseases are things like educational inequity or health inequity. We know in King County, your life expectancy varies by zip code, more than 10 years in some communities. So we were treating the symptoms, and yeah, the first job of the physician may be to alleviate the suffering of the symptoms. But if you don't treat the underlying diseases, the patient dies. And I think there are fundamentally three underlying diseases that we need to focus on and that are hard for people to talk about, but are essential. The first is structural racism, which we'll talk about a lot more during this session, and you'll hear a lot more from the panels about the need to address the underlying fundamental challenge of structural racism. Gender inequity, the fact that 75% of homeless families are headed by single moms, and that single moms are economically the most challenged constituency in the United States of adults. And the third is extreme wealth inequity, which means that, over multiple generations, particularly families of color, have not had the opportunity to amass the kind of wealth that white families have amassed, whether you go to the GI Bill or whether you go back even further to our country's history of slavery and of stealing native lands. So those three diseases, structural racism, gender inequity, wealth disparities, I think are the diseases we need to address and treat if we're actually going to alleviate the suffering of the symptoms of things like homelessness.
Yeah, that's really a great metaphor, David, and it's one that I think a lot of us are thinking about. And so in particular, there are many members of Funders Together to End Homelessness, private funders, philanthropic funders on this call today. And so are there particular lessons that you think that philanthropy can learn from our experience in trying to create a systems approach where maybe we were more focused on treating the symptoms rather than the overall disease? So, keeping with your healthcare metaphor, what would you advise fellow private funders in the field about how to think more holistically in a way that could be more successful?
Yeah, great question. And I have several thoughts, and I'm going to shift metaphors because I love metaphors. First of all, I think one of the things we missed in constructing and in implementing the family homelessness strategy was not putting racial equity at the center and not utilizing the tools, for example, of John A. Powell's targeted universalism. That's a critical ingredient for philanthropy and government and everyone actually to consider. And the best metaphor for targeted universalism to me is, very often people say in this country, well, we're all in the same boat. Well, we're not. When the storm hits, some of us are in giant cruise liners. Some of us are in enormous pleasure craft. Some of us are in little fishing boats. Some of us are clinging to a piece of flotsam and jetsam in a raging sea. And the intervention that each of those different parties need during a storm varies radically. The person in a large cruise ship doesn't need a thing. The person who's clinging to a piece of flotsam and jetsam risks losing their lives because they're in the water, and everything in between. So targeted universalism basically to me says you need to target the intervention so that the myth of a rising tide lifting all boats is dispelled. And you realize that there are communities and constituencies that need very different interventions in order to achieve the desired outcome that we have universally for everyone. And to me, that lesson really means that we have to figure out, by disaggregating data, by looking very specifically at individual communities and their concerns and their issues that they bring to the conversation, not that we bring to the conversation, which means including at your table communities with lived experience of homelessness, as well as providers, as well as government, as well as corporate, as well as philanthropic sector, and ensuring that the solution is crafted collectively.
Really great use of metaphors there, David. I love the way that you bring different imagery to thinking about these different problems. And really excited, I'm going to put a plug in for your breakout session that you'll be doing with Katie Hong from the Rakes Foundation, who also worked with David at the Gates Foundation early in the development of that strategy. Both David and Katie will be participating in a breakout session that's specifically labeled Lessons from Philanthropy, but I think that you'll be able to address a lot more concepts beyond just what philanthropic funders can learn from. And just in the time that we have remaining, David, there are two key partners that you alluded to earlier, Building Changes as well as Westat, who played key roles in the implementation of the work, starting from the very beginning. And I'm wondering if you can just say a little bit more and highlight the specific roles that each organization played throughout the implementation, and the role, say a little bit more about the roles that they played and the importance of their work.
Sure. Well, I'll start with Building Changes. And Building Changes' role evolved over time in fascinating ways. Initially, we reached out to Building Changes as the intermediary partner because the Gates Foundation is not an operating foundation. It was basically you and me doing this family homelessness strategy, and we couldn't operate in the field the way some foundations operate in the field. So we needed a partner that could work both as a regranting entity to provide financial support to the counties and the providers that were doing the work, as well as ensuring a consistent approach to implementing the theory of change in each county, even though each county tailored its response very specifically to the circumstances of its communities. But what's interesting about Building Changes approach is that it evolved over time. And I speak now in my retirement as a board member at Building Changes. So one of the key features that Building Changes brought to the conversation early on was the disparities by race that homeless families experience in our target communities and nationally. And it was research that they, together with other partners, conducted that even showed us the way the tools we were using, like the VI SPDAT, there's a mouthful, was itself a tool that was a racist tool, that was not treating all families equally. And now at Building Changes, there is a real focus on what does it mean to be in the world of working to end homelessness, an anti-racist organization. And in that work, we need to learn from partners in our local community that have been working on anti-racist issues much longer than Building Changes has. But nonetheless, it's a priority now for Building Changes to say, what does it mean to do this work in a consciously anti-racist fashion? So that's the Building Changes piece. The Westat piece, the folks at Westat were, Deb Brogg and her team were, I think, the only consistent thread of the same people for the entire duration of the family homelessness strategy. And what we really wanted to do was to create a longitudinal evaluation that tested the efficacy of the interventions that were being done in each county, and to provide us with longitudinal data about the experience of families sort of before and after the systems changes were put in place that could tell us whether or not we had succeeded. And the data they collected from more than 150 families in each community, in each cohort, is a gold mine of information that I think Deb and her team will be mining for years in terms of insights about what works, what doesn't work. And I think will become one of the richest data sets about the experience of homeless families that's ever been created in the United States. And I'm really excited to see what continues to emerge. And in addition to providing or collecting data throughout the initiative, Westat also provided feedback in the form of reports about their data that greatly informed the work moving forward and helped each of the counties further tailor and adjust and correct the work they were doing in the field with their partners. So it was not just a sort of external, we're way back here and we're never going to talk to you, but it was really kind of a rolling process of using the data that was collected to help inform the work moving forward. It's really exciting for data geeks like you and me.
Great. And so we have a question from the audience that I think that we both can address, which is really a good question, which is, can you talk about why the foundation decided to sunset this initiative? And the person who asked the question said, I'm wondering if it is related to the inability of philanthropy to solve family homelessness. So why don't you start? We can tell this story together about why we recommended to the co-chairs that we ramp down this initiative.
Well, I don't know who asked the question, but the question is spot on. And it goes to something Katie and I think we'll talk about in our session on the role of philanthropy. But I think that philanthropy's role is to develop and test solutions, which is to say, what will solve family homelessness in these target communities? And our goal was to say, what happens if you actually create a system of care where there wasn't one? Where instead of having to make 45 phone calls, a mom and her kids can make one phone call and find help. That's philanthropy's best shot, is to say what works. But philanthropy doesn't have the resources to scale what works into something permanent that lasts. That's government's responsibility. Government can't take the risks with its dollars that philanthropy can, because it's limited taxpayer dollars and you're accountable to the taxpayers for those resources. Philanthropy, to be totally blunt, at the Gates Foundation, we're accountable to Bill and Melinda and Warren Buffett. That's it. So we can take risks that they sign off on to test new solutions to problems. But even the resources of the Gates Foundation, the billions of dollars that exist at the Gates Foundation, can't take those solutions to scale. That's government's role. So I think what the family homelessness strategy was able to do was to say to these three communities, a system of care to address the inflow of families into, or the outflow, sorry, of families into housing from homelessness is something that local governments can do in partnership with their federal resources, their state resources, and their local resources. Proof point demonstrated. Now, government, take it to scale.
Yeah, and I guess the only thing I'd add to your answer, David, to go along with that, is that a lot of it really does come down to our recognition, and we made the recommendation to the co-chairs back in 2016 that we actually ramped down the strategy based upon what we were seeing as what we thought the impact of our outflow focused strategy would be, as well as that the problem was now largely one of inflow, relating back to the issues that we've talked about, affordable housing, systemic racism, all of those, the root causes of the disease rather than the symptoms. And to think about the scale of those problems relative to the amount that private philanthropy can put into it, we came to the to that conclusion that it really has to be a government-led drive. And in particular, we'll be talking a lot more about this during the final session of today, where Greg Colburn and Chris Coe and Heather Worthington will be really talking about the specifics around affordable housing and what the cost would be to build affordable housing at the scale that we are increasingly becoming clear on will be necessary to make a dent in homelessness. So with that, David, I want to thank you again for coming back out of retirement to do this work, and to thank you for all of the work that you've done over the many, many years to address this problem. And we look forward to your breakout session with Katie Hong a little bit later this afternoon. Thanks so much, David. Appreciate it.
My name is Sinead Colston. I'm a behavioral health case manager in a local nonprofit here in King County. As a case manager, I connect individuals and families to resources and services here in regards to their immediate crisis or challenges and barriers that they're facing. I'm a single mother of 8 children, ages 4 years to now 18, and that's including 3 sets of twins. In August of 2017, I had made the decision to flee domestic violence, and I left my partner in that situation. There's 9 of us, so shelters don't have the capabilities of taking that large of a family. And then 2 of my children have autism or behavioral health challenges, and so that causes people to be uncomfortable, and so we've gotten kicked out and denied options. We were living in my car, our SUV, shelters, hotels, staying at friends' house, sleeping in cars, safety parking lots, things like that. At the end of that, probably like, I don't know, I'd say like 14 and a half, 15 months into my homelessness, I was connected to the King County Diversion Program, and talked to this case manager, and she was like, oh, well, we're just going to help you with that, and we'll move you forward. And the diversion program itself housed me and my family in basically 48 hours. if I would have had access to that way early, when I first became homeless, like I would have been homeless with my kids sleeping in our car for like a year and a half. So we would have avoided like all that extra harm, all that extra trauma, all that extra stress and worry of like providing for them while living in a vehicle. Now that we're settled there, my kids are thriving. They go to one of the best school districts that we have out here, and are currently like in therapy, obviously, because we're leaving domestic violence. There's some challenges with that, but overall, we're thriving and being healthy, like physically, mentally, and spiritually. So it's good.
Wow. Excuse me. Thanks so much to you, Shanae, for being here today and for agreeing to share your story with us. It is so terrific to hear that your kids are thriving and to know that you're now able to bring your talents and experiences to work for others going through the same challenges. We so appreciate your willingness to share experiences with us today. It's so important for us to continue to listen to people with lived experience and to empower the community to be a part of the solution. So, as David mentioned earlier, one of the key components of the Family Homelessness Initiative from the very beginning has been the longitudinal evaluation conducted by WESTAT. And so to familiarize us with the approach and some of the key findings from the evaluation, I'd like to introduce Annie Panucci, who currently serves as the Director of Impact and Evaluation at the King County Housing Authority, but who previously served as the Director of Evaluation at Building Changes, and she'll be facilitating our next discussion. Annie?
Thank you, Colin. I'm Annie Panucci. I worked with Dr. Deb Rogg and the WESTAT team in the later years of the Family Homelessness Initiative. And I'm here today with Dr. Rogg to share some of the key findings. Research always contributes to learning. And in this case, what's really thrilling is that, as we heard a little bit ago, it really informed action and hopefully moved some outcomes along the way. So why don't we start with an overview of the evaluation? So to kick us off, Dr. Rogg, what questions did the Family Impact Study intend to answer? And what was your general approach?
Okay, thanks, Annie. And I'm going to have a little help on the PowerPoint here. So we had 4 main questions that we were looking at. And really it maps over to the design as you see here. We had, because we did this for over a decade, we were able to look at implementation over time. How did the initiative unfold? And as David mentioned, we have a formative aspect to that. We provided data back to the counties and to the foundation and to Building Changes as we were learning it, particularly as the systems are unfolding. We were looking at the same time. And so when we were doing that, we were doing comparative case studies where we were looking at the 3 demonstration programs, tracking them over time. I'm sad we're not able to see them there because we saw them at least once a year, if not more. We collected data from 30, 40 people in each county. We were there 4 days a year, 5 days in King County. We did interviews, we did focus groups with families, we did focus groups with staff. We reviewed documents, and then we had 2 contrast counties that we also went to where, because we knew other things were going on, to see what we could learn from them and also help us kind of see what may be going on in the 3 counties that's different. We looked at implementation, and we also looked at the effects of that initiative on the systems and organizations within them. So the systems data, again, at the same time we were looking at implementation, we were asking about other changes that were taking place. But with the case studies, we did case studies of housing organizations and other organizations to see how those systems changes were impacting them. The third main component and the third key question was, and the one that really matters, right, is what's the effects of these systems changes on families? And we were very focused on housing access and stability, as well as family stability. We did what is called a quasi-experiment. You can't randomly assign people to which system to be in. Random assignment is often what you're looking at in an efficacy study, but we tried to design as rigorous a study as we could with a pre-post cohort design. Before and after systems reform. We had about 500 families in each cohort, little more than 150 in each of the counties. And in each of those cohorts, we tracked those families for 18 months after they received assistance. So we did an in-person interview every 6 months. We also were afforded access to the Washington State data, which is a very rich integrated client database across multiple agencies, over 30 agencies. And that allowed us to strengthen the data that we already had. It allowed us to look at other counties as well as comparison. So it really enriched our data. I want to say one of the things we're very proud of in our quasi experiment, and this was really the resources that the foundation were able to provide us to have very high response rates. So for every interview with families, it was about 80% of that cohort. And then finally, we're looking at what's the cost of serving a family before and after systems reform. That study is underway right now.
Thank you. That's very well-rounded, comprehensive approach. Before we get into what everyone wants to hear about, which are the family outcomes, tell us a little bit about what you saw as major system changes over the last decade.
Great. Yeah, as David was talking and we were thinking, when we started this, again, we started collecting data. We started working with the foundation in 2007. But we designing the study and designing it actually collaboratively with the counties and with families in the counties, having them really give us input. But we did the data collection starting in 2010. And we found that at that time, the best way to think of the systems, and I should probably have systems in quotes, because they really weren't systems. It was more of uncoordinated continuums. There were many housing providers in each of the counties, and families had to access systems going shelter door to shelter door, often to many of them, trying to see if there was room. They often got on wait lists, or if there weren't wait lists, they had to continue to call. We guided this, the framework you have here is kind of aligned with the pillars in the theory of change. So how did you get access to homeless assistance? How do you get access to homelessness prevention? Early on, there wasn't connected. There was one time or limited assistance, prevention assistance, but it wasn't connected with the homeless system. It was separate. The housing access was really the continuum piece. People went from shelter, generally stayed in shelter about 3 months, then went on to the transitional housing that David and Colin spoke about. And then hopefully there was something they could transition to. That could be 18 months, it could be 20 months before they're able to get that. And there was a housing readiness focus to it. Access to services wasn't coordinated, nor was access to economic opportunities, sort of jobs and education. Some providers had their own, but there wasn't anything with mainstream systems. 2019, we took our last look at the communities. Again, we had looked all the way along. And what we found is all three communities had reformed their systems. They now had access to homelessness assistance. It's really through a coordinated entry process of case conferencing, dynamic prioritization, looking at people's needs, assessing those needs, and trying to match services, housing to that. Homelessness prevention was probably one of the biggest changes, but it really wasn't prevention. In one county, they are doing more prevention work with dispute resolution, legal assistance, but in the other two, they really adopted something called diversion and called it diversion first, which is what resources are there? Resources we can give you now, and I think we heard Sinead talk about that. She got it in 48 hours. Are there some resources that we can have that can avoid you getting into shelter and getting you in right away? Do you need a down payment on the house? Do you need first and last month's rent? Do you need a work license that can get you working, that you can do it? So whatever of that needs, sort of short-term limited resource to get people in. And that particular thing is now, the diversion goes to all populations, all homeless populations in the counties, and has really been now a tool that other communities are looking at. Access to housing shifted from the continuum to a rapid rehousing. Again, diversions fits into that, but there was also rapid rehousing resources that were more flexible, and really sort of realigning the transitional housing to more permanent housing, with all of a housing first, not a housing readiness, but a housing first. The last two pillars were less systematically implemented. There were more challenges with those. There has been more of an emphasis on cross-training and connection with providers, and there has been more of an emphasis on economic opportunities, but there has been difficulties in engaging the mainstream services. So both of those areas reformed some, but not to the degree that I think was hoped for in the theory of change.
Thank you. From no system to a system.
Yeah.
Now let's turn to the main findings. What were the key housing outcomes? Did the initiative make a difference?
It did. It did. The first one we see is that this chart here helps illustrate what we found as a major one, is that more families in cohort 2. So we compare cohort 2, which is after systems reform, the families who tracked after systems reform, with cohort 1, the families before that. And our reports that are on the website give a lot more detail statistically how we did this and how we controlled for other differences. But what you see here is there was a major significant difference in the cohorts in the number of families that were able to access over the 18 months access housing, their own housing, and how quickly they did it. So if you look at the end point there, the 480 days or so at the end of where we were able to track, 75% of the cohort after systems reform access at least one day in their own housing, compared to 46% of the earlier cohort. And if you look at about 180 days, which is about 6 months before that, you'll see that 60% of the families in cohort 2 had already accessed versus 30% in cohort 2. So they were accessing much quicker. They're getting into housing, and then most of the getting into housing are getting in quickly. If we look to the right side, this is measuring stability. So each of those bars that you see there were the percentage of that cohort, green being before systems change, blue being after, that were in housing at the time. So what you see is, if you compare, it's 0% at baseline to 14% at cohort 2, and they get in very quickly with diversion, being able to stay in there. Then you look at 26% to 55%, 33 to 61, and 39 to 62. So it's increasing over in cohort 1, but never to the extent that you see it in cohort 2. Cohort 2 spent an average of 266 days over the 18 months in their own housing, compared to cohort 1 families before reform that spent 138 days. Well, the other thing this illustrates is by the 6 months, 55% were in, and then it's kind of steady going on there, where it's a little bit more of an increase, a lower percentage increase in cohort 1. Okay, so those two, we have a couple more. The other thing that we found, and I'm really focusing on the housing outcomes, is we looked at returns to homelessness for those that went into housing. And we see the rates both are relatively small, average about 10%, and are comparable for both cohorts. So we didn't see a decrease in that, but we didn't see an increase at all. And again, we're seeing more families going into their own housing. The next one, I think, is I know that it's the outcome that is the more troubling one for us. Homelessness, if you add it up, stays about the same between the two. There are more people, though, that are sheltered homeless in cohort 1, less in cohort 2, but we have an increase in cohort 2 in terms of unsheltered homelessness. We think that's a little bit more of a trend of what's going on, probably emphasizes more. Again, I think a lot of we were hearing the inflow, outflow in terms of where there's room for folks. It also is an issue we talked about that got, I think, resolved by the counties. Coordinated entry initially also included shelter, and that is separate. And now that it's separate, people can get access to that when they need it without going through all the other targeting. But it is an area of concern for families that are not able to access housing.
We got a question from the audience. You had mentioned the different approaches among the counties of diversion versus dispute resolution. Did you see, or did you hear from the counties whether there were any conclusions drawn over whether either is a preferred approach?
No, I think it differed. I think they're doing different things. And I think there also is an issue that counties are different. I think that we know that in the prevention, and counties try different things. We talked, Colin talked about risk taking and being able to do things. Pierce County out the gate, Pierce County really wanted to do prevention. And they started out the gate combining that with coordinated entry, and their year resources were expended in 3 months, I believe. The outstrip demand, the demand outstrip supply. So they went back to the drawing board. For Pierce and King County didn't try it. They felt they really could not do a good job at that, but had to do it more at, if they wanted to use quick as people were coming to the door. So I think it depends on the county and how they're set up in terms of what they can do.
That really brings me back to the point we heard earlier about listening to communities and tailoring services and systems to the unique context in each community. Good. Going back to the housing outcomes data that you saw, were there any stories that illustrate these findings from the family perspective?
Yeah, one thing we did is we did trajectories of change over time. We looked at families that got into housing relatively quickly or got in and then stayed in. We looked at families that maybe got in and dropped out. We looked at families that never accessed housing. And I'm just going to give a couple. I'm going to give one of a family who got in and stayed in, and then one of a family that got in and where it didn't work for them at that time. So let's start with Angela. She was a 36-year-old mom of 2, living with her husband and working part-time as a home health aide. She and her children left their home because it was abusive. There was domestic violence. She contacted coordinated entry and was referred to a rapid rehousing program, but she found it difficult to find an apartment that was near her children's school and large enough for 3 of them that she could afford after the rapid rehousing assistance ended. So she stayed in shelter for a while, and then they were able to find an apartment. She received money for a security deposit and moving expenses and got 6 months of rental assistance, which we saw about the average for rapid rehousing in this initiative. She was able to increase her hours at work and was still in the apartment at the end of the follow-up, at the end of the 18 months. So that was a good story. But Ruby was an unemployed 28-year-old single mom who had a baby who moved out of her boyfriend's apartment when their relationship ended. She was in her car for a few days, but was able to move into a shelter soon after that, after she contacted coordinated entry. When she was in the shelter, she was offered rapid rehousing assistance, and she found an apartment within 2 months. She stayed in that apartment for about 6 months, but she couldn't afford to pay it when the rental assistance ended. While she was receiving rapid rehousing, she was offered assistance to find a job, but she couldn't work because she couldn't find childcare for her baby. And she didn't have other resources to help her. And sometimes people have family or others, but if you don't have anything else, you're stuck. So she had to leave that apartment, and she moved in with an aunt who lived out of state, where she remained for the rest of the follow-up period. So those kind of give you 2 kind of, parts of the puzzle there.
Thank you. I know that the full evaluation looked at a wide array of outcomes. Can you give us a sense of what other outcome measures you looked at and maybe what did or didn't change over time?
Yeah, and we looked at a host of things. We focused on a set of, for our report, our 18th month report, another set of sort of secondary outcomes. So we focused a lot on the homelessness and housing outcomes, but we also looked at employment and income and changes, and we did see increases in that. Both cohorts, though, were different in where they started out on income and employment, and we have also looked at the state data, and we saw that statewide. So that really is sort of more of a secular change that we saw. We did see an increase, a more increase in the cohort 2, but we also, this was done during an economic time where it was an economic boom for the area. So we don't really know how much was the cohort and how much was the economic boom that made the difference. We do know that same economic boom should have depressed the housing outcomes because the housing market was so tight and so expensive. So we know the initiative made a difference there because it was fighting against a tide. We also looked at, so we did see changes in those 2 outcomes. We didn't see any changes in family intactness, whether families separated more or separated more or reunified more. There was no difference over time. And there was no difference in child absenteeism or child transitions. With respect to returns to homelessness, I know there was a question on that. The rate was low, and let me say, the returns to homelessness were among those who went into their own housing. And the returns were not just to the system. They were returns to because we had interviews with people, we knew if they were back and living with a car, we knew if wherever they were going. So it was that.
Yeah, yeah. And one thing to keep in mind, I think, when you look at returns to homelessness and maybe lower rates than you were anticipating, is that there's a distinction between returning to homelessness and housing stability. So there could a lot of people do achieve housing stability, but some may be housing unstable, but not necessarily return.
Right.
Yeah.
They could be living doubled up. Some of them are going into a motel and paying what they can pay there, but that 10% was both living on the streets and living in shelters, going into shelters. Streets or abandoned building, any kind of unsheltered situation.
We had another question from the audience related to the unsheltered outcome. And whether there was a goal to reduce days unsheltered upon engagement with coordinated entry. Was that part of the original thinking around systematizing access to the system?
I think early on, we didn't really see a lot of unsheltered homelessness among families. I don't think that was part of the thinking. I think it was really focused on shelter. That was a phenomenon that really developed over time. There was some people living in cars early on, but our cohort 2, cohort 1 baseline saw very little of that. When we did histories of families going backwards, there was not a lot of it. There was a little, but not a lot. So I think, as that moved forward, the coordinated entry systems responded to it by looking at the shelters and having more shelters. So in King County, Mary's Place was something that developed over time, and that they were able to have more shelter space and not link it with the coordinated entry system.
Another question from the audience is whether you looked at outcomes disaggregated by race or ethnicity.
So that, as you heard, we did not start this. We didn't design the study to have race as a major differentiator. So, and what I mean by that is we tried to get as close as we could as a census of families coming in. And we obviously measured race and measured it very specifically, but we had very, very small numbers other than people being African-American or Black or being white, or if the ethnicity Hispanic. All other races we didn't have enough on. So what we did, we didn't see any differences after first assistance in race, except for multiracial tended to have more positive outcomes. Those who I defined as multiracial, and individuals who defined as Hispanic had less positive access to housing. They had a much harder time accessing housing. We didn't see any differences for African American or all other races. I do want to say, though, we weren't able to measure whether they had access, whether there was differential access into coordinated entry. It was sort of after they got assistance, we didn't see differences due to that.
Yeah, lots to learn about access in the future. We have just a few minutes left. We'd love to hear more about what other communities can learn from this effort. What is Westat's main takeaways from the family impact evaluation?
Well, I think there's a couple. The first two, I think we prioritized getting families into housing as quickly as possible. That looks like the way to go. Maintain access to shelter separately from coordinated entry. I think that's obvious from the unsheltered. Then we had a number of things that we saw of other factors that related to people's being able to be more stable. There were people with more human capital were more likely to be stable. So we think focusing on that is important. It's not the only thing. Another finding we had is that access to subsidies made a huge difference in whether people remain stable over time. Our 30-month study that will be coming out soon shows that that's particularly for those families that went into shelter initially, that they had more access. That appears to be pretty important. And for the families who never had access, they were 4 times less likely to have a subsidy. So there's something with the subsidy that's really important. We also found that families that were larger, that didn't have, that had a lot of homelessness history and not much housing history, and had recent evictions, had a much tougher time, not only accessing housing, but also staying housed. So those were really important, but access in particular was really key for that. And then transitional housing, both in terms of being the main piece of cohort 1, before reform, and also whenever it was used in cohort 2, tended to have less positive outcomes. So we really find that reducing the stock of that makes sense, and considering repurposing or targeting those resources if you have it for families that are not making it in other ways.
Thank you. I think you touched on this a little bit. We had another audience question about to what extent did the evaluation account for affordable housing stock? So you mentioned the presence of subsidies, but was the availability of affordable housing a control variable or part of the context that played into your interpretation of outcomes?
Yeah, we looked at housing market. We looked at the vacancy rates, and then we looked at cost of housing and whether the cost of even just the fair market rent was going up. And they were just coterminous with our cohorts. When we looked within cohort, we didn't see a huge impact within cohort, but we did see that we couldn't have it in our models per se, because it was such a change. And particularly from 2014 to 2016, there was a huge increase, that decrease in affordability, I guess, and decrease in vacancies.
Mm-hmm. Were there any findings that just completely surprised you?
No, I think some of the strength of the findings some of the strength of the two cohorts, and also the strength of some of these other predictors that were there. I also think one of the things when I talked looking at these trajectories of change, that the families that did not access across the over 18 months in cohort 2, and it was about a quarter of them, didn't have the vulnerabilities as a whole that you would think. It was really a broad array of families, and what they lacked were resources. They lacked some human capital, but they lacked access to subsidies, and they particularly lacked income. So it wasn't, oh, they're all individuals that have drug issues and mental health. In fact, some of them had much less than that.
Mm-hmm. I know that the time frame of the evaluation ended before the pandemic, but there are any takeaways that seem particularly relevant right now?
Well, I think the data are pretty much indicating people can make it in housing and make it in quickly. So the more that we can have, housing made available. I know that there's been bills to have more subsidized housing or to have more access to housing, but getting families into their own housing quickly.
Mm-hmm.
People don't have to be, people are housing ready.
Yeah, that is always a priority, quick. Well, we are out of time. Thank you so much for the overview and all of the hard work that you and your team have put into this initiative over the years. I know we've barely scratched the surface, and wanted to remind everyone that we have breakout sessions. We're breakout session number 2 called Lessons from the Evaluation, when we'll have an opportunity to dive deeper with Dr. Rogg and her team. And please bring your questions. I'll be there to facilitate.
As president of Seattle University, let me say a little bit about the partnership between the Gates Foundation and Seattle University in order to develop advocacy to end family homelessness. The Gates Foundation approached Seattle University back in 2009 in order to seek whether we could be a partner in regard to this very important effort. We have so much service learning at Seattle University and significant relationships with the people of our neighborhood and in our community through multiple kinds of programs. So there's a lot of resources that we can bring in addition to our academic excellence at the university to this issue. So there were 2 parts of the partnership that developed with the Gates Foundation, both of which were very significant and equally important. And the first one was about communication. How do you develop the kind of communication that can lead to clarity about what the issues of family homelessness? How can you develop the advocacy, and therefore how can you promote the actions that will be required of the entire community to address family homelessness? The second area was the area about the faith communities and Because of our School of Theology and Ministry, Seattle University has very deep and very extensive connections with not only Christian faith communities, but also Jewish faith communities, Muslim faith communities, and others. And the belief of the Gates Foundation and Seattle University is that there's a lot of social capital that exists within faith communities that could be utilized for ending family homelessness. So these two areas between communications and faith communities are the essential parts of what was the partnership that we've had and we've so much enjoyed. What pleased me so much was it allowed an opportunity for our students to be engaged in each of these areas and to be working with communications professionals, working with faith communities, working with people that really they can learn so much in the process of being involved. You all have an opportunity to learn more about this through the programs later in this day that we hope that you'll plug into. That'll tell you more about what is the role of strategic communications in regard to family homelessness and around faith communities' involvement in it. I'd like to express my gratitude to the Gates Foundation, my gratitude on behalf of Seattle University and as its president for seeking us as a partner in this. It allows us to fulfill our mission and also the mission of the Gates Foundation. So thank you very much, and I hope you'll fully participate in this day. Thank you.
Well, thanks to you, Father Steve, for all of the tremendous work that the entire Seattle University community took on to raise the profile of the issue of family homelessness and to advocate for positive solutions. I'm looking forward to the breakout session that you mentioned that Catherine Hinrichsen and Lisa Gustavson will facilitate, in which they'll share many of the creative projects and initiatives that Father Steve discussed in that video. Want to let you know that thanks so much for sending so many questions to our Q&A panel. Sorry that we're not having time to address all of those questions directly in the panels, but want you to know that all of those questions are being cataloged for the breakout sessions. So if you attend the breakout session for the plenaries that you're curious about, you'll have a chance to ask those questions yourselves, and the facilitators will have those questions in hand to answer for you. So really hope that you'll stick around for those breakout sessions, but keep the questions coming because we are keeping track of them. And next, we want to turn our attention to the specific role that government played in fostering systems change over the past decade. And so I'd like to hand things over now to the awesome Tabitha Blackwell, the Director of Networks and Program from Funders Together to End Homelessness, who will introduce her panel of representatives from King, Pierce, and Snohomish counties. So over to you, Tabitha.
Thank you, Colin. Hello, everyone. I am Tabitha Blackwell, Director of Networks and Programs for Funders Together to End Homelessness. I'm excited to moderate what I know will be an engaging conversation around government's role in fostering systems change. And so today I will be joined by three panelists that will be describing the work that has been done within their respective county. And I'm happy to have with me Anne Marie Edmonds of Pierce County. And we have Trina Van, who did some great work over in King County, and then Mary Jane Burrell Vujovic, who is out of Snohomish County. So we know that there's tons to talk about, and we want to jump right in. And so what we've heard over the last couple of hours has been what changes we've seen over the last decade. And I'd really love for each of you to first introduce yourself and then tell us how the Family Homelessness Initiative changed the way your county responded to family homelessness, and how did your crisis response system improve? And so Trina, we'll have you kick us off, and then we'll follow up with Mary Jane and Anne Marie.
Sure, I can get us started. Hi, everyone. My name is Trina Van, and I was a project manager with All Home in King County. I want to thank the foundation for the opportunity to participate in today's convening. I actually recently moved to the DC area, but it's really nice to get to spend the day with my Seattle friends. So, as I was thinking about this question, I started with a whole list of innovations that we tested during the past 10 years. And how many things we were actually able to launch under the initiative's purview that have now become part of our day-to-day. But I'm going to pick 3 things. It was really hard. So I think the first thing was coordinated entry. I think everyone who's sort of attending today's event knows that, it was a little bit of a painful process, not just locally, but across the country. But I can't speak enough about what it afforded us as having a new vantage point to the day-to-day operations of our system. So we could see just how our system was designed to favor some and disadvantage others by quickly exposing the number of barriers that combined across all programs systematically denied shelter and housing to the most vulnerable people in our community. Those who didn't have advocates working alongside them or the capacity to navigate the complex set of requirements and needed to find available resources that David had mentioned earlier on. So I bring this up because it really gave us our first insights at an institutional level to the discriminatory impacts of our existing practices. The other 2 projects I wanted to name in particular were diversion and a rapid rehousing project that intentionally was designed to support Native families experiencing homelessness. And I just want to name my colleague Danielle Winslow, who was particularly instrumental in that, the design and launch of those efforts. But we understood that one of the levers we had to work with that could improve outcomes for families experiencing homelessness was to ensure that people didn't have to enter emergency shelter to access permanent housing. So by pairing flexible client assistance and engaging with families as they were presenting for shelter, we could offer alternative supports so families could avoid coming into the system and build on their own existing strengths, resources, and resilience. So as diversion was underway, we were also seeing kind of the real power of this intervention, and actually we're finding early on that it was utilized by far greater rates among families identifying as Black or African American. We had opportunities further along to test and refine the strategy, and we're able to couple expanding diversion resources, centralizing our funds through a pool of funding, and bringing on local experts representing BIPOC communities and people with lived expertise to serve as diversion coaches who now provide training out to the community to support others in learning this approach to working with families. So David also referenced targeted universalism, which is a strategy that we deployed as part of our rapid rehousing efforts. And so we were able to target initiative resources to community-based organizations serving Native and Indigenous families. Implementation didn't move forward without issues. We, as we tend to do, we over-designed and over-prescribed policies and procedures that actually got in the way of what we wanted to do, which is to really give power to community-based organizations to do what they do best. But we were able to deploy those resources specifically in a very targeted way to help Indigenous families. So I use those examples too, just within the framework of the initiative, which we leveraged. Because while we also hired additional experts who represented BIPOC communities and people that lived experience of homelessness, we were able to initiate conversations about the root causes of family homelessness, namely racism and sexism. And I just want to take a brief second just to recognize my colleagues, because they represent people with lived experience and racial analysis expertise that propel those efforts forward. So Danielle, Felicia, Lamont, Zachary, Joseph, Dimitri, the Lived Experience Coalition, the diversion coaches, including Shanae, who you heard from, the People's Institute, Guru, Mary Flowers. I mean, the list could go on, but what I think it also demonstrates is the capacity needed for this work. So I think utilizing the platform that the initiative provided us and this framework that we were given, it not only allowed us to do the work differently, but we also were allowed to plan, coordinate, and partner differently.
Perfect. We'll have Mary Jane now.
Great, thank you so much. Good morning, everyone. I'm Mary Jane Brel-Vujovich, the Director of Human Services in Snohomish County. And I too would like to thank the Foundation for this opportunity to speak with you today about what we have learned over the past 10 years. The team in Snohomish County has largely been, many of the members of the team are the same members who were involved in this at the outset. So for me personally, it was very interesting to listen to David and Deb and be reminded of how things have changed and how substantially they've changed. Initially in Snohomish County, when the initiative started, we didn't really have a system What we had were individual programs that were connected in our case by what was called community case management, was really a system-wide waiting list. So people didn't have to make so many calls in Snohomish County, but nevertheless, they made a call and then they got on a waiting list and not much happened for quite a while. When people did get contacted, there was a focus on moving people to shelter and to transitional housing. And for people who didn't get into transitional housing, there was really a limited opportunity to be able to connect with all the services and resources that people might need, families might need to address their issues. The system and how it was designed and how it worked at that point was largely informed by what the federal and state governments told us the system needed to do. And it was a challenge that there was not really a lot of voice of people with lived experience informing what the system did. After 10 years, we have transformed into a system. And what was that wait list period became a rapid resolution period, where can we connect people with navigators who help them figure out where they are, where they want to go, and help them devise a plan for how to get there that's really person and family centered, trauma informed by the challenges people face with systemic racism and sexism, and really help them move in ways and address those challenges that they face as they go. I think a question was asked, the approach became a housing first approach rather than becoming housing ready, using rapid rehousing a great deal more on what was available in the private market. We focused a great deal on prevention, and while it has been a challenge to stretch resources to do that, we've maintained that focus. The first prevention activities were focused on helping people who are at imminent risk of losing their housing through eviction with dispute resolution and legal services, but it did expand to include rapid resolution services, which I think are very much like diversion services. We don't use the term diversion in Snohomish County, which is something I'd be happy to spend a whole lot of time talking about. In terms of really getting more people access to individualized and tailored services, the system is doing that. And a better and continuously improving attachment to labor force programs. There's still plenty of work to be done there. Also, over the course of developing this, the system change, we have been informed by the voice of people with lived experience from the very outset, and we had engaged with business, government, and community connections to help us do that. We've also raised the awareness and diversity on our partnership to end homelessness, what partners are involved in services in Snohomish County. We went from a system that was collecting data for HUD that couldn't really answer questions in real time into a system that can answer real questions in real time about what is going on, so that we can make appropriate changes and address discrepancies and disproportionality very quickly. I will say too, another thing that has happened in Snohomish County through all the partners coming together and continuously coming together to function as a system as opposed to individual entities, is that we weren't just building a better system to address family homelessness, we were building a more resilient community. And that's been tested twice in the last 10 years, the first with the State Road 530, excuse me, flooding and mudslide incident, and of course now with COVID. So my hats off to all of the staff, the partners, our partnership to end homelessness, which has guided this work so effectively and efficiently, and our incredible community partners who have risen to every challenge. Thank you.
Thank you. Thank you very much. And Anne-Marie will go ahead and finish up with you here.
Great, thank you. I'm Anne-Marie Edmonds with Pierce County Human Services, and much of my comments are very similar to my colleagues who have gone before me. While our communities were different in our approaches and our challenges in many ways, there was a lot that was the same and it was such a privilege to be able to learn from one another as we had 10 years of learning together. So very similar to actually what Mary Jane just shared, in Pierce County, we very much had a system that was separate and disparate providers. And that comment that David shared earlier about it took something like 20 something or 40 something phone calls for someone to get housing, like that really was shocking to hear and to learn and to realize that seeking help was so hard and required this level of perseverance to get meaningfully connected to something to help you. So when we talk about how this initiative affected our community and our system, we really moved from a whole bunch of providers all defining and moving toward ending homelessness in their own way to a collective goal and vision, with each playing a part instead of each trying to do every part of what needs to happen. And so we described that shift really from being provider driven to being provider informed and funder driven, and creating this system design for how that approach should go. And I would say too, well, I started the beginning of this initiative actually working for Building Changes, and then partway through the initiative, I started working for Pierce County. So I missed the beginning of the initiative with Pierce County, but was able to watch as each county began their approach and their system design. And I would say that one of the ways in which Pierce County grew was really working with providers to design that system rather than doing that independently. And I think we still have room to grow in doing that even more so. But that was something, having that concept of a design and having that informing from so many different voices toward that system made a big difference. And we actually launched several different learning collaboratives. We focused them around different interventions, but that was a way to regularly talk with our providers about how is it going? What support do you need? What's working? What's not working as we see these things out? And that was a big byproduct of how we engage with and how we stay connected with our providers. And likewise, there was this very big shift to being strength-based and not being housing ready, but being housing first. And honestly, Tabitha, this is an overwhelming question to answer because there's so much to say. It's really difficult to capture the whole of our changes. So I'll pause with that so we can chat a little bit more, but I just would echo so many of the things we've heard from, I mean, the presentation from Deb to what we heard with Colin and David, as well as my colleagues who've spoken before me today. There's just, it's night and day from where we started to where we are now. And two, just echoing that there's more to do. There's always more improving to do and learning to do. And we in no way have arrived, but it's gratifying to know how far we've been able to come to make such an impact, really to prepare us for what we're seeing now. I can't imagine if our community had made no changes over the last 10 years and we're facing what we're facing now. It's frightening to think about.
Yeah, and it is a lot to think about, and part of reflecting in any sphere is really digging deep. So I want to thank you all for being vulnerable and really sort of going down memory lane. And of course, sometimes the greatest impact that's seen through a project or something is not really in the successes. Sometimes it's the challenges and how you were able to overcome them. So I would love to sort of get to that space and sort of transition us into knowing what you know right now. What would you have done differently to achieve a greater, even greater impact over the last 10 years? And so I'm actually going to start with Mary Jane, and then we'll go to Anne-Marie and then Trina.
Well, thank you. I thought so much about this question. I wanted to take 1 second to talk about, I think that what went well, and that was that for us, the theory of action remained a very functional and useful North Star throughout the entire process. And we could always turn back to that as a way to keep moving forward. I think we also felt that testing a whole system worked well for us, the building out of tailored services from the beginning very purposefully, working very purposely to build organizational capacity and collaboration and create an environment in which we could change culture and try to work to create that trust. Worked well to start getting formative feedback from the very, very beginning, to know that we needed to focus on data quality and utility, but I think there's also more that we could have done there. And integrating that feedback from people who lived experience from the outside. I think all of those things were great. Now, what could we have done a whole lot better? I think you've heard over and over again, focusing on racial equity from the beginning. It just wasn't on the radar. And, as we moved in that direction, we really saw the systemic issues and that's where we had to do some re-engineering of our own systems to try to address systemic issues. We're still working on it. It's a work in progress. It will never be done. Recognize the challenge of sustainably working with other mainstream systems. This was huge. I think we know each other, we can talk, we can figure this out. Well, in truth, we're all funded to do different things that are ostensibly to help the same people, but that's where it ends. And whenever you have means-tested programming, you're figuring out who gets the service and who doesn't. And each of these programs have different means tests and different expectations in terms of outcomes. So I don't think we thought enough about that. And I think we maybe tried to do too many things with too many systems too quickly, rather than really focusing strategically on one or two key systems. So that is something I would probably, you need to eventually work with everybody, but I think approaching that strategically would have been more helpful for us. In retrospect, I would have had more staff working on data and data analysis earlier than, we all want to put money into services, but as we saw, and I know that Jesse Jorstad is here, who's really helped build out our capacity and systems. So a shout out to him for the amazing work he did in helping us do that, and to Nate Marty, who laid the foundation for that great work. Focus more on advocacy in a purposeful way from the beginning. We kind of talked about advocacy, but we didn't really go, what are we going to do here? I think in Snohomish County, we did work collectively with affordable housing, the development of affordable housing, and that work was going on somewhat hand in hand. But while we were doing that work, we completely missed that low rent housing, which was defined by Harvard as $800 a month or less, was being destroyed faster than we could ever build anything. We just, that is something we try to work with with other governmental entities in the affordable housing community on what we do about that. Be more purposeful in thinking how the system can flex. We started with in the middle of a recession, and then have had a very hot economy since then. And how do you, what flexes and how, where are the places where you can move and flex in response to those changing macroeconomic conditions? Because I think, as David pointed out, as you go upstream to causes, our executive talks in terms of service and technology excellence program and how do we continuously improve. And I was very pleased to see that we are, as a system, collectively continuously improving. But one of the tools you use in that is called the 5 whys. You don't start with why are people homeless? And you keep moving upstream and you get back to those 3 factors David talked about: structural racism, gender inequity, and the extreme difference and change and gap in wealth and what it costs to live in terms of wealth and people who don't have wealth, and now what it costs to live and what people are earning. We're talking about a federal minimum wage of $15 an hour. In Snohomish County right now, it takes $30 an hour to live in a studio apartment and not be housing burdened. Huge gaps. We need to get upstream, and I would try to spend more time on how does what we're doing intersect with advocacy and those macroeconomic conditions from the outset. But it's been an amazing learning experience. It continues to be a learning experience. 10 years in, we're still learning every day.
Anne Marie?
I would echo so much of that from Mary Jane for sure. A couple of the things that I had jotted down was especially a deeper focus on data earlier, absolutely. And as well, I know one of the themes between all three of our counties was the difficulty of connecting with other sectors. And early on, we tried to either replicate those services ourselves, or we tried to pay those sectors to participate in our systems. And we just didn't have the funds to like ongoing support that level of shared coordination. So trying to crack that nut earlier, and perhaps investing in coordination between systems, because that's really where families get lost, is speaking to a number of different people over and over and over, and having someone to sort of be their advocate as they navigate several systems to try and increase that. We didn't really start to test that until just at the very end of the initiative, at least in Pierce County. And then I would also say engaging our shelters earlier. So someone mentioned earlier just the difficulty of connecting coordinated entry with shelter and the slowdown that caused into shelter. But I would say also we almost have the reverse problem now, where you don't have to go into coordinated entry to get into shelter. But once someone is in shelter, they've got to get connected with coordinated entry to be getting an exit from shelter. And if you imagine a Venn diagram of the population in shelter, and the other half of that is the population that's in coordinated entry, we would want those to be completely eclipsed, and they're not. And it's troubling, the amount in which they overlap. It's not enough. And so that creates a significant challenge. And so I think part of our, if I could go back and do it again, I would engage our shelters in the system design much, much earlier. And then lastly, I mentioned that we had made that shift earlier from being provider driven to funder driven. And the last piece of that is that it needs to be consumer informed. And I think we could have done a much better job of trying to incorporate our consumers into the design earlier and more meaningfully than I think we did. So that's something we're trying to think more critically about now, how to meaningfully incorporate that voice into the constantly improving, because as I said, we're not there, we haven't arrived, and we're still grappling with what does it look like to be a system that is effective and efficient, but is also truly meeting that person where they are and not treating them as a cog in a system, but having a meaningful engagement. So much we could have and would love to have done differently, but I want to make sure Trina has an opportunity to share as well. So I'll pause there.
Trina, one last minute, and then we'll close us out.
I'm going to try to make this sweet. I mean, echo. I think, and I'm going to use the soapbox that's been given to me today, but I would have to say leading with racial equity is by far the miss that we made at the start of things. And there's been a lot of conversations about sort of the macro issues that sort of perpetuate homelessness and the disparities that we see. But I think we also need to really be intentional about what questions we're asking our own system. Who's being served by the homeless housing system? How are they being served? Who's better off and who isn't? I also think that we need to ask ourselves why, if we know homelessness is caused by racism and capitalism, why our response is generally led by white people, founded on white saviorism, continues to criminalize the poor, and largely focuses on intervening at the individual level, which perpetuates this myth that homelessness is caused by individual factors and not societal ones. So I would say we should be challenging ourselves as funders to consider the faces of our policymakers. I mean, no disrespect to Anne Marie and Mary Jane, but who's presenting today and representing our government partners. And I think we really need to start breaking down old norms, be willing to take risks, be willing to be uncomfortable, push against the edges of our the conversations that we are having to think about the changes that we need to do within government.
Thank you all so much. And I think that was a great great space to land on given the questions that were coming in as we were talking. And so if you were one of those folks who have questions that we were not able to get to here, I really would love to have you come to the breakout session number 3 and dive deeper into government roles and fostering systems change with these fabulous panelists after we are done with all of our presentations. We look so forward to seeing you all in the breakout sessions, and thank you, delightful panelists, for joining us today, and thank you all for joining us who are participating.
Oh man, that was awesome. Thank you so much for that rich discussion. Tabitha, Anne-Marie, Mary Jane, and Trina, I got to tell you that working with you all over the years has been such a highlight for me, and we so appreciate your passion and dedication to the work. So we've been all sitting for a little while, and so we're going to take about a 15-minute break. We'll reconvene promptly at 10:25, and we encourage you to keep your Zoom link logged in. That way you won't need to re-log in. So just keep your mute on, keep your camera off. You know, as they said in the old days, don't touch that dial. We'll see you back at 10:25. Thanks, everybody.
Hi, I'm Linda Olson. I work with the Washington State Coalition Against Domestic Violence as the housing director. The State Coalition is an organization that is a membership organization, over 70 members across the state that we provide visionary leadership for. We support these programs, and we engage the public together with these programs to play a role in ending domestic and sexual violence. The Gates Family Homelessness Initiative reached out to us through Program Officer Marie Sauter with the idea of asking what would be possible for domestic violence survivors if a housing first approach was employed. The housing first approach for domestic violence survivors has really needed to take into full consideration their unique needs related to safety and confidentiality. It also has required a sense of working in community if you speak of housing first, and how survivors are embedded in the community often stay in their community. We've worked specifically with communities of color, culturally specific community, tribal programs around the state, and being able to really focus on what works best for them has been very key to Housing First. I am excited about welcoming as many of you as possible to our session later. We will feature Ginny Ware, who's the program manager at New Beginnings, one of the demonstration sites, so you can hear more about implementation and what that looks like. We will also be featuring our researcher, Dr. Chris Sullivan with Michigan State University. She is doing a 24-month longitudinal study on the impacts of DV Housing First in comparison to services as usual. So you should be able to ask questions and learn quite a bit about what that process is.
Well, thanks so much, Linda. I'm very much looking forward to your breakout session later today. It's such important work that you've led over the years. So we now want to turn our discussion to the provider perspective. What did it feel like within the provider community to make the changes that we've heard so much about already today? And for this discussion, I'm excited to introduce my good friend, Gordon McHenry Jr., the president and CEO of United Way of King County. So Gordon, please take it away.
Alan, thank you very much. It's really great to be here. A lot of recollection and a lot of learning, and we appreciated it because I was at Solid Ground during the time of the Homeless Initiative, and now at United Way. I really have a great panel, and I want to turn right to them. Delmar Aji, who's a housing program manager at Catholic Community Services in Pierce County. Vicki Hilty, domestic violence executive director, domestic violence services of Snohomish County, and it was Tumi Nightgum, director of housing at Wellspring Family Services. We heard earlier in the conference today from Westat some of the quantitative learnings that have occurred. And now I think there's an opportunity to hear some qualitative perspectives from service providers who are up close and personal dealing with our neighbors, our families struggling with homelessness in all 3 counties. And I'm going to start with Delmar from Catholic Community Services in Pierce County. If you'd please describe the way in which your agency interacted vis-a-vis the Family Homeless Initiative. And when you think back over the past 10 years, what's changed in terms of the approach by Catholic Community Services? Delmar?
First off, I want to thank you for having me today. I truly appreciate it to be amongst such great people that do amazing work in your respective communities. So thank you so much. Gordon, to answer your question, first and foremost, I've been with Catholic Community Services now for 5 years. I'm a leap year guy. So in a few weeks, it'll make 5 years. And so I can kind of speak to the way that the system worked before, even though I wasn't necessarily a part of Catholic Community Services as an agency just yet. But then I can kind of progress into where we are today. And so speaking of how our system worked prior to this initiative, it was a tad bit, and Anne-Marie actually spoke to it in our previous session. It was a little bit all over the place. You know, families would say, oh my God, I'm homeless and I don't necessarily know what to do or where to turn. And so what they ended up doing was kind of focusing on, say, like a single agency. And so they would, you know, go to that single agency and they would say, hey, I need some help. And that agency had like their own waiting list if they did have any kind of openings. And you know, it just wasn't streamlined. And so what this particular initiative did was it allowed us to really focus on streamlining a particular system, that being the coordinated entry system. And so it was also mentioned earlier that initially a lot of the dollars were spent focusing on homeless prevention in Pierce County. And that didn't necessarily work well. If all of us can imagine on this call that homeless prevention is one of those things that we just kind of went through pretty fast. And so then there was a shift to diversion. And so diversion was the definite game changer. And so if you can imagine in that previous system, a lot of people would also turn to Access Point for housing, which was our old structure and way of doing business. And so it was one particular screening line. And, you know, it was always flooded. There was never really a way to get through. Just because of the volume of people. Pierce County is a large county, the volume of people that would call that particular line. And so what happened is whenever we made the shift into homeless diversion, it just allowed for things to just flow a lot better for us. And so just to kind of bring you up to speed as to where we are right now, we have changed so much and we've learned so much. To echo everyone, you know, in going into a diversity and inclusion lens and looking at things from that perspective, that's something that we are now aware of. At Catholic Community Services, now speaking more specific about our particular agency, we've been able to partner with some really, really good other agencies, just as an example, Associated Ministries, and coming up with creative ways to tailor the services that we have to offer for the community. And so what we've done is we've actually used this particular initiative and all that we've learned from it to now tailor ways to make things better. So as a result, we now have a Black group of pastors that are now doing this bit of work. And that's something that they're subcontracted through through Catholic Community Services to do. We also were able to create what's called the Community Homeless Resolution Partnership. And so what that is it's focused on those areas that are geographically not served as well, because obviously a lot of our services are centralized in the Tacoma area because that's the most urban area. But we have to remember that there are other places in the community as well. There are other places in the county that just aren't getting, you know, the folks are homeless there as well, but they're just not able to get to those centralized services. And so the Community Homeless Resolution Partnership, what it does is it actually trains people to be able to serve, you know, just your normal community folks, to be able to actually serve homeless families in their respective areas. And so that's been another thing as well that we've really taken to and we're really proud of. And that's something that in 2021, we feel is going to really just take off. And so just to provide a few even data points as to where we were and to where we are now. So when we first started, we actually were just opening up these diversion conversations to families. And so quickly we learned in about 2016, the beginning of 2016 or so, that this is a service that should actually be offered to everyone. At first, we just wanted the low-hanging fruit, you know, to see if these particular families were divertible, and it was very successful. So what that did is that actually transitioned into a lot of our community partners saying, "Okay, I love what you're doing. How can I do this too?" And so that really just kind of snowballed in a good way into all of the different areas where we eventually developed and where we are right now. So again, just throwing some data out there, we're successfully diverting about 20% of the folks that come, you know, just as a whole into our system. So if you can imagine, there are folks that come in and they now have a diversion conversation, which again began with our one initial grant from Building Changes, and you know, where the technical assistance was provided for us, and we were able to really kind of cling to that and build this particular system that we're in now. So again, you have all these different folks that we were serving, and out of the people that we would serve, 20% of them were successfully housed at the end of the day. And so that's a number that we were really, really proud of, that did help us to expand a lot of our services and a lot of recognition from all over the place. Now we have 15 or so agencies that actually provide diversion conversations, and we've even changed the name in which we do this. So now we actually call it Creative Conversations, because we do have prevention dollars that are out there, and people that are doing prevention work. And it's some similar types of strategies and using that conversation to help folks resolve their homelessness.
That's great. And we're going to talk a little bit about the importance of geography and the importance of intentional service to our racial and ethnic members. But first, I want to hear from Vicki. We'll go up to Vicki, and at Snohomish County, and would love for you to give us a little bit of perspective on how you got connected and how your agency got connected, and what has evolved, or what have you discerned over these 10 years? And I get to say that you're on mute.
There I am. Okay.
All right.
Thank you, Gordon. And thank you, everybody. I'm really glad to be here. I'm Vicki Hilty, Executive Director, CEO for Domestic Violence Services, Snohomish County, and I've been there going on 20 years. So it's been a while. And I will tell you, nothing made me happier than to be able to talk about our work through Sound Families. So as we know, domestic violence happens every day. It happens every hour. It happens every minute of every day. People have to make hard choices, and they have to make those hard choices every day, every hour, every minute. So they have to decide, do I stay? Do I go? Do I walk on heels? How do I protect my child? What do I do next? Where can I go? So we all know that a lack of safe and affordable housing is one of the leading causes to remain in a violent home. And, you know, shelter is not always the answer. For many, many years, we kind of sent people that direction because that was process, but we're advancing and learning as we go along. And instead of placing people automatically into homelessness, we began to look at the bigger picture. So sometimes it's just that hand up, right? And so for many, to avoid having to become homeless, we could help with rent assistance. We did deposit, gasoline, plane tickets to get safe, and the list kind of goes on and on. In 2014, we were honored beyond words to be recommended by our county, Snohomish County, and to be awarded a 2-year systems innovation grant from Building Changes. And they trusted us to help our clients make the best decisions for themselves and their families. So with that, we were able to hire 2 full-time employees, one a navigator, one a advocate, to help us disseminate flex funds and reduce the time families spent homeless by providing rapid rehousing services and placement. So we use those funds to assist with housing stability, including activities which kept families from shelter that didn't need to be there, and help them move on rapidly. So our goal was to serve about 120 families. In 2014-15, we served 157 individuals. In 15-16, 294 individuals, and that totaled about 311 families. So job well done. We saw success after success as we were able for the first time to help people where they were. So we were able to help people catch up with their rent, put locks on windows, deposits. Every once in a while, we had only so much money, but so we were pretty careful with it. But first and last month's rent, gas cards, uniforms to help people keep their job, glasses that may have been broken and just needed replacement, and plane tickets and so much more. Our smallest gift that we gave to anyone to help them with their assistance was $3. Believe it or not, $3 is all this person needed. That's all they needed to keep them from becoming homeless. They needed disillusionment documents that needed to be printed to be able to move forward, which would help them out. $3. I mean, that's ridiculous when you think of that. Our largest was just over $3,000. So with these funds, we were able to really help people where they were in that moment. And I'm going to add really quick a short story because I'm kind of a storyteller. But the Mukilteo Police Department reached out to us one day, and they had a young woman who had called and said she knew her mother was in that city. She did not know where she was, but she knew she was in trouble. How they found this woman, I don't know. I, to this day, do not know how they did, but they did. And when they knocked on the door, they said, "Your daughter's trying to find you. She's worried you're not safe. Are you safe?" And she said, "No, I'm not." So they came in, helped her, got her in a car along with her dog, uh, and brought her to us. And in 24 hours from that moment, we were able to use these flex funds to help her and the dog get on an airplane, and she was back in the mid states with her daughter and safe and being able to start over again. So there was story after story of those flex funds being able to be used for that. It opened a whole new world to our agency. Honestly, for the first time, we were really able to assist people with what they needed and when they needed it. People didn't have to wait until they were pushed into the street or into a shelter, or what was not the most ideal, of course, for their family. So in 2021, where we are today, we still have flex funds. We actually have more flex funds. We've learned how important it is to have those dollars. And we, of course, now approach our grantors who help us with those dollars. We learned also to ask donors for additional dollars around that, founding organizations, and so much more, because we had statistics and we had information now to be able to show them how important this was. So we use those flex funds for our clients, their families. We're grateful every day for the faith that Building Changes and our county gave to us. And in 45 years, this agency has had several milestones, I will tell you. Our first new safe houses eons ago, the first shelter, new facilities, and then flex funds. So these funds have been a game changer, and we are just honored to do the work.
Vicki, you are a exceptional storyteller, because I think all of us were wondering. So, does she have flex funds? Do they have flex funds? Has it grown? How is it how does it benefit the services? And for those folks who are able to stay with us and join the breakout session this afternoon, I would encourage you to continue the conversation about the benefits of flexible funds in delivery of services, and also, and of course, the partnerships with donors and our public funders. I'm going to go over to Nish Toomey. It's great to see you again, and Wellspring Family Services here in King County. Can you give us some perspectives on the connectivity, Wellspring Family Services to the Family Homeless Initiative, and some high-level reflections on where you've gone, or your agency has gone over these past 10 years in terms of service?
Absolutely. Okay, and it's Duni Danigu Nawishtamai Naikan. Good morning, everybody. My name is Nawishtamai Naikan. I am the Director of Housing for Wellspring Family Services. Really grateful to be here. First, I want to talk about how all of the programs are so implemental to our mission, which is ending the cycle of family homelessness. We have the ELC, which is the Early Learning Center, and I feel like it's one of the greatest programs that I know of. It's been around for 33 years this March. It is tailored to children who are experiencing homelessness, and it's licensed to serve up to 50 families. One classroom is not open right now due to lack of funding, but we would love to have that classroom opened. We also have like the baby boutique. The baby boutique has been open since the 90s, and it's served over 37,000 families that has been able to, get the items that you wouldn't be able to get if they were experiencing homelessness, like shoes and clothes, books, things for school, supplies that they need for diapers and wipes. And being able to have that at hand is just like a great wraparound services, and with all the rest of the services that we have here, especially with our housing programs. Within ELC as well, I just want to say that they have an early childhood mental health focus. So they have a therapist in there that is able to focus on, secondhand trauma of experiences of homelessness for children, and also the secondhand trauma of the teachers who also serve these children. Really grateful of all of the work that they do. With our housing programs, we do prevention and intervention. So we serve families in helping them with rapid rehousing. So the housing first model, moving people in as fast as we can. During the pandemic, we've seen trends of families experiencing domestic violence, just like Vicki was talking about, and how this has been really impactful for the families we serve, for the children attending school, and how we can support them through this. Last year in 2020, we served over 2,300 households in preventing their homelessness. So our shift of prevention work has gone, it's grown so much to make sure that people do not enter homelessness, that we prevent it. And we've moved on into Pierce County, where we're trying to expand services to reach the Tacoma school districts and also the Renton school districts and Seattle school districts, to do family resource exchanges, give people the opportunity of resources, and also the opportunity of enrolling their children into the Early Learning Center, getting them baby boutique items, seeing how we can be more resourceful with the work that we do, not just for those we serve, but for the community around us. It's community driven, and making sure that the work we are doing is culturally relevant to those we serve. So I'm really grateful for all of the work that they're doing. And also during COVID, we got the City of Seattle hospitality contract, where we're helping those who are hospitality workers who've experienced less hours cut because of COVID. So there's so many different departments within Wellspring that has been a wraparound service for everybody, whether it's EAP, Early Learning Center, the Baby Boutique, our prevention programs to keep people housed, and our intervention programs to make sure we're setting people up with the tools that they need. We're giving them the tools of their story of how we can support them to end their cycle of family homelessness.
We only have about 4 minutes, and so I do see some questions, and we're going to make sure those questions get answered in the breakout session. But we've heard from a couple speakers already about the importance of disaggregating data, of targeted universalism, of dealing with structural racism. So just very quickly, Delmar, Vicki, and Noshumi, can you tell me, how has your agency evolved with regard to dealing with the racial inequities that exist in our region? And what would be the one thing that you would think we need to do to be more effective in dealing with racial inequity? Delmar, you first.
Sure. So as I mentioned a few moments ago, we're very intentional in our service delivery through Catholic Community Services. Beginning with our staff, we have an extremely diverse team that does, that's there to greet our homeless families, brothers and sisters that are in need. But the main thing that I want to draw attention to is our very intentional work with the Tacoma Ministerial Alliance. And so, as I had mentioned before, this is a group of Black pastors in Tacoma that have really had a passion and heart for this work. And so what happened is, with us being such a large agency, we were able to kind of absorb some of the growing pains of the Tacoma Ministerial Alliance, again, with help from the Associated Ministries group, to put things together for them to be able to serve the Black community. Also, we have a large presence in our Native community. We have a group of people that, first and foremost, on our diversion team that go out and serve those families as well. But more than anything, though, the Tacoma Ministerial Alliance now is in year 2 of doing diversion work, which, of course, was all initiated through Building Changes. And we've seen a lot of success in the cultural competencies that they bring to the table. The ability to relate to the community. Those are the nuanced things that we really do thrive on as far as that service delivery piece to our community.
Great staffing and partnership. Appreciate that, Delmar. Vicki, how about you up north in Snohomish? Well, up north for me in Snohomish County, and domestic violence focus.
Without question, the importance of racial equity goes without saying. And we're really working hard really to start within, kind of as Delmar was saying, it's really looking at our staff, and then looking at the clients we serve and making sure that the clients that we serve have someone who represents them, who can speak their language, who can relate one-on-one, and then marketing to that group and saying, what can we do more? How can we engage you? What can we do together? So that's one of the things I would say that we're really trying desperately to do and to stay in. And it's hard work, and recognizing that, but knowing it's important.
Great, thank you. Staffing, outreach, working on that relationship. Newishtomi, can you bring us to a close with your thoughts and perspectives on this?
Sure. With Wellspring, what we've been doing is having DEI work within each department of Wellspring. So we have a diversity, equity, and inclusion specialist who actually helps us with onboarding of courageous conversations, understanding white supremacy culture, and trying to break down the white supremacy culture that, we see within systems and the bigger systems of where, marginalized populations, experience, not being able to get through and receive services. So I would say our work is driven by all of that.
Great. Just the beginning of some really important conversations this afternoon. There'll be a breakout session. I think it's number 4, and Emily Mira, Senior Manager at Building Changes, will be the moderator or the facilitator. Please line up your questions and come to that breakout session. These are really important topics as we approach family homelessness and racial disparities as a region with some incredible partners. Thank you all three, and I'll turn it back over, I think, to Colin.
Thank you, Gordon.
Hi, everyone. My name is Colleen Echohawk. I'm an enrolled member of the Pawnee Nation of Oklahoma. I also belong to the Upper Athabascan people of Mentasta Lake, and I am very honored to be the Executive Director at the Chief Seattle Club. My work at the Chief Seattle Club is focused on serving Native people who are experiencing homelessness. We do this by serving them through food, showers, laundry, but also we provide housing. We know that people of color have higher rates of homelessness, and so it is imperative for us to serve them, to provide services that truly work for our BIPOC community, our Black, Indigenous, and people of color communities. And when we think about the Family Homelessness Initiative, one of the things that has become very clear for all of us is that we have to have culturally informed services. We have to have a race and social justice lens, or we are not going to be serving our community. I want to invite you all to join me and to join Allison Moon from Mary's Place and Donalda from the Chief Seattle Club in a breakout session to learn more about the work at Chief Seattle Club and to learn more about partnering with agencies that are serving our homeless families in a culturally appropriate way. It'll be a really wonderful time to talk about cultural humility, to talk about partnership, and to be together and to serve our relatives as best as we possibly can in partnership. So thank you, and I hope to see you there.
Well, thanks so much for your incredible leadership, Colleen. We're really looking forward to digging into the amazing work with Allison and Donalda that you just described during your breakout session this afternoon. So one of the key drivers of the improvements that we've been discussing this morning has been the cultivation of a data-driven culture in each of our demonstration communities. And to describe the way that this culture was developed and nurtured over the years, I'm very pleased to hand the Zoom mic over to my Gates Foundation colleague, Juan Sanchez. Juan, take us away.
Thanks, Colin. Welcome to the Data-Driven Culture Initiative panel. In this session, we are going to talk about data and how data makes us better at what we do. How data was a game changer for this initiative. I'm going to begin by having the panelists introduce themselves, their role in this initiative, and how long they were a part of this work. I will then provide some context and then jump in to the questions for the panelists. My name is Juan Sanchez. I work at the Bill and Melinda Gates Foundation, and I've been a part of this work since 2011. Jesse, can you introduce yourself first, and then Christina?
Certainly. So my name is Jesse Jorstad. My pronouns are he, him. I work for Apt Associates, but I was with Snohomish County since 2012, although I joined the initiative in 2014, and I was there through the end of the initiative in 2020. Thanks, Juan.
Christina?
Hi, everyone. Thanks for having me here today. I'm Christina McHugh, she, her pronouns. I'm the evaluation manager for housing and homelessness with King County's Department of Community and Human Services. I have been with the county since November of 2018. So I kind of caught the tail end of the majority of the work of the Data-Driven Culture Initiative as part of the FHI. But I've been here ever since working on the sustainability piece. And so I'm going to talk a little bit about how we've been able to sustain all this good work.
Thank you, Christina and Jesse. So I'm going to talk about how this initiative got started, because how does someone create data-driven organizations? We use that term a lot. And when we started, I asked the question, what do you mean by data-driven organization? What's the purpose? And people would say stuff like, oh, we're going to get better at measurement, or we're going to get better at reporting on things. Or my favorite, we're going to be more accountable to our funders, like the Gates Foundation. That is how people talked about what a data-driven organization is. What we found out through this initiative was being a data-driven organization made us much better at learning and much better at growing. The purpose of being a data-driven organization is to ask smarter questions of the data to solve a problem. The challenge was the only anchor we had to get our answers from at the time was HMIS. And we needed to figure out how to use that data smarter. The counties absolutely could use HMIS for reports, but they spent so much time creating reports, they did not have the time to ask more interesting questions of the data, to dig deeper into the data. HMIS was really good at starting conversations, but the counties needed the time and capacity to analyze the data smarter. We learned that done right, data makes us better at what we do and will make a larger impact in our communities too. And that is what this discussion is about. We are going to learn from Christina and Jesse how they helped their counties become data-driven organizations, how they started asking smarter questions of the data, learning from the data, growing from the data, and how they helped more families find a home. Jesse, to start off this discussion, can you tell us about what data analysis looked like in Snohomish County when you started in your position, and what were the changes that took place?
Absolutely. So first of all, thanks for the invite. You know, there are so many communities that are trying to figure out how to do this work. And I'm really honored to share what our experience was. And I hope that other communities can learn from it and implement some things that will help them on their journey. So in 2014, HMIS data were very opaque. From the front end that had a very closed security model, which meant that organizations couldn't see each other's data, to the back end where we were really limited to extracting data that was using this querying tool that was unique to our vendor, and there was no training available and there was no manual. So it just was a very difficult process. We ended up doing all of our analysis in Excel. And even the simplest data requests would take days to turn around. And then even slight expansions from the original requests, like could we see this data by race, meant that we needed to start over because we probably hadn't pulled that column in the first time, right? You know, initially when my colleagues in King and Pierce County were brought together to work on creating a dashboard to show the progress of the Family Homelessness Initiative, there were a lot of challenges in doing this. So I think it's important to note that there were really no dashboards on homelessness at the time. So we weren't even sure exactly what we were supposed to be envisioning. Our best reference for a dashboard was the kind on your car, right? The other thing is that we all had separate instances of HMIS and they had different vendors. The data standards at that time were not as mature as they are now. And what that means, kind of in plain speak, is that a field like your client ID was called the client ID in one system and the person ID in the other and a personal ID in the other system. And we needed somebody to be able to take all that data and make it speak the same language. And that had to happen across, you know, over 100 different fields. We had to reconcile the way that that data was working. As we came closer to a joint dashboard, though, the tension became more apparent because the data leads saw the potential for what the kind of analysis that this dashboard illustrated could potentially do. But the differences between the counties, the sheer size of the King County data set, and then the level of the data, meaning that it was the family system, it wasn't the whole system, and it wasn't the project level, made turning insights into actions extremely difficult. So suddenly we had these new insights into our systems, but we didn't know enough to be able to do anything with it. So the data-driven culture was really the result of all of us realizing that if we wanted data-driven decision-making from the counties would need to be in the driver's seat for that analysis. While there were a plethora of tangible products that came from this initiative, I had folders and folders of ad hoc analysis that came out of this and some dashboards that I still think of really fondly. The greatest gift is actually maybe the most replicable for other communities. And that is a data transformation process that standardizes the tables, which allows for the building of the dashboards and the ad hoc analysis. Now, what does that mean to a non-data person? It means that we are taking tables which, when data is written to a database, it's done mostly in numbers. And so as an analyst, when you go to pull that out, it's not ready to analyze because you need to figure out what all those numbers mean and map it back to text, right? This programming takes all of that, does it for you, and then does some of the most useful calculations, the things that you keep coming back to, like how long are people in programs and at what rate should they return to homelessness and what's the rate of exit to permanent housing. It groups the data in meaningful ways. Nobody wants to know. I think there's like 27 destinations. No one needs to know how many people went to a specific destination, or at least that person is really unique, right? We want to know how many people went to permanent, right? So it groups all that information for you. It creates a file that is ready to sort of plug and play. And we were able to get familiar enough with that file that we knew right away how to chase down the next question and how to turn that analysis around. So that's sort of in a nutshell what it was like in 2014 and kind of a preview of what it was like when I left in 2020. It went from, you know, it taking days to turn around a simple data question, and there being data questions that we couldn't even pursue because we didn't have the capacity, to being able to be asked a complex data question and turn it around in a couple of hours. Thanks, Juan.
Thanks, Jesse. So you can tell we're going to have a really great afternoon session. So don't forget to click on that data session for us, okay? Christina, my question to you, can you tell us how has the work evolved in your community and what has taken to sustain it over time?
Sure, I'm happy to do that one. And thank you, Jesse, for setting up kind of what we created through the DDCI. In terms of how it evolved, I'll kind of start with where I found it when I arrived at King County in 2018. You know, we did all of this with a lot of support. So at that time, we had support from a firm called Vistric, which helped us write all that code that turned the messy HMIS data into these transformed common tables. We had a little bit of support from the Tableau Foundation that gave us some new tricks in our tool belt so that we could create better and better dashboards. We worked with a design firm that helped us figure out what should that first dashboard website look like, because none of us were web designers and we wanted to make sure we were meeting the needs of our audiences. But since then, really over the course of 2019, we became 100% self-sufficient as a county and not only maintaining this, but growing it. So I'll talk a little bit about what it took to get there, but we now, we maintain that monthly data transformation process entirely in-house. We have continued to iterate on our public dashboards. You know, beyond that first 2019 dashboard release, we have continued to annually revamp the entire website, add new slicing and dicing of the data, and try to increase our emphasis on disaggregating data and racial equity. But I think in terms of sustaining it, I think it's important to start with, it really wasn't a question of whether we were going to sustain it, it was how. The return on this investment was enormous. You know, this data, it wasn't just about a dashboard, it became integral to our program operations, our policymaking, budgeting, planning, evaluation, you know, and obviously our accountability and making it available to the public. So really it set an expectation, it set a bar, and it was about how are we going to continue to meet that bar. And I think the first ingredient of that was that we had really strong leadership support. Our leadership had a vision early on that led them to participate in this initiative. And they continue to value and support data and building a data-driven culture. You know, because it became so integral to our business operations as a system and as a county, we've continued to staff up. So we are now 5 evaluators deep in housing and homelessness and continuing to grow this year, even given kind of the lean times that we're in. We hired a full-time dedicated SQL programmer that maintains all of that code that transforms the data. They kind of do similar work for some of our other program areas in the department beyond homelessness. So this model is really influencing how we do business writ large as a department, not just within homelessness. And obviously we have a lot of IT resources that the county has provided as well, space in the cloud, KCIT support, our IT support to kind of keep these things going. So we've just really been lucky in that regard. And our King County Council has continued to fund this work, which is fantastic. The initiative also really fundamentally changed the way that we staff our evaluation team. So our job descriptions now all say we require someone who has SQL experience, R experience, and or Tableau experience, hopefully all 3, and at the very least the capacity and willingness to learn those skills. And so we've really kind of tried to, as a larger performance measurement and evaluation unit, standardize the tools that we use and have high expectations for the skills for the staff that we bring on. And then lastly, I think a key ingredient of the success of the sustainability has been having a really strong partnership with our HMIS lead as a COC and our HMIS system administrator, which is BitFocus. Really the data that comes out is only as good as the data that comes in. And you know, Jesse mentioned the standardization of HMIS. There were data standards when we started this initiative, but in 2020, we got kind of thrown for a loop during the very year we had to bring all of this in-house. And the 2020 data standards codified coordinated entry for the first time on a national level, which really reverberated through all of the work that we produced out of the DECI. And so we were meeting, weekly with our HMIS lead and our system administrator and our evaluation team to map out what would a new coordinated entry workflow look like on the ground, in the front end of the data system, and also on the back end, so that we could then adapt all of our code and monthly refresh processes to make sure that we maintained continuity of operations. And so I know I was super proud of all the folks that worked on that project, because we did manage to bring all of this in-house and adapt to those data standards without one delay in our monthly refreshes or updates of our public dashboard. So it was really, really great to see.
Thanks, Christina. So you can see that we're going to have a really great discussion this afternoon. And if you want to find out how you can change the world with data, don't forget to click on that data button this afternoon for the breakout. Talking about changing the world. Jesse, my next question goes to you, and it's going to be the same question I'm going to throw down to Christina later. What was the biggest impact on your communities, and how did that impact benefit families? So Jesse, I'm going to hit you first for that question, and then we'll jump down to Christina. Jesse?
Yeah, so I would say, I'm going to give a general and a very specific answer. So first of all, it made us so much more competitive for funding. We were able to really demonstrate to HUD and to other funders that we had a working knowledge of our data. And that even though there were performance areas that maybe were not going in the direction that we wanted them to go, we understood why it was happening because we were able to really dig in. So that competitiveness for funding has brought in additional funds into the community, which means there are there's additional inventory for people to access, and that's really important. But the other piece has been the access to the knowledge, which allows us to form policy and then observe the impact. So it allowed us to understand how the system was working and how it wasn't. We found out that families were spending a lot of time in shelter, especially very large families. So we used that information to create a direct connection between emergency shelter and rapid rehousing. And that connection helped to reduce the time that families spent in those projects from 278 days in 2011 down to 97 days in 2017. So that has been a huge success. And it was really the thing that we needed to take our system from a very static, people were kind of landing in projects and then just staying there indefinitely, to being able to get things flowing again so that folks were not just stranded in shelter with nowhere to go.
Thank you, Jesse. Christina, we have about 3 minutes left. Can you tell me what the biggest impact in your community was, and how did that impact benefit families?
Sure. So I think I would again point to our ability to disaggregate and slice and dice the data in a way that is quick and systematic and replicable, and just really sped up our ability to answer questions. So, I think understanding how well the system is working for families means also understanding what makes families unique compared to how the system serves single adults or youth or other subpopulations. So I think, we're just able to kind of think bigger in terms of our research agenda. We're able to do more sophisticated data analysis and evaluation. We actually worked in partnership with Building Changes, I think it was last year, on an analysis modeling how well rapid rehousing was working for families. A lot of that was led by Building Changes, and so we were able to kind of see within families, how well was the system working. I think we found that, veterans tended to have stronger outcomes. Youth had, families that were led by someone under the age of 24 were more likely to not be successful in rapid rehousing. Female households were more successful. So being able to kind of dig into that type of analysis wouldn't have been possible before, because we were, again, as I think Jesse mentioned, just very bogged down in the day-to-day. The simple things took a really long time. And so now we just are able to do so much more.
Yeah, over here.
Christina, Jesse, thank you very much. And to everyone else, don't forget to join our breakout session this afternoon. Thank you, everyone.
Hi, I'm Nan Roman, President and CEO of the National Alliance to End Homelessness. The Alliance is located in Washington, D.C., and we look at data and research to try to figure out what the solutions to homelessness are. Then we work with policymakers at the federal level to get solid policy and resources behind those solutions, and we help communities implement those solutions. The National Alliance to End Homelessness has been a national partner with the Gates Family Homelessness Initiative really from the very beginning. We shared what we felt we knew about solutions to family homelessness and things that we saw that were working elsewhere. We also learned very much from the initiative, and we shared that information with others across the country. And that work has really informed our federal policy work. It's helped us to advance things at the federal level like Housing First, diversion, and coordinated entry. I would just like to take a moment also to recognize the incredible work that the Gates Foundation has put into this effort to reduce and end family homelessness. They've been so strategic in what they've done. They've used their influence as an organization to do advocacy at the state and federal level and really to spread the news around to other parts of the country. They have understood the importance of partnerships among housing, healthcare, employment, child welfare sectors, and they really have been determined and steady partners to make a difference in the region in terms of family homelessness, and it's worked.
Well, thanks so much to you, Nan, for your continuing partnership. You know, there's no way that any of our communities will be able to succeed without a vastly stronger federal response. And we're so lucky to have you and the National Alliance to End Homelessness leading the way in Washington. Hopefully, with the new Biden administration and some true champions in key positions, we finally have the opportunity to bring about some real change that can make a difference on the federal level. And I also want to give a shout out to members of the United States Interagency Council on Homelessness and other federal agencies who I know are on the call today for their dedicated work over the past decade under what I'm guessing were some very trying circumstances. So the WSTAT evaluation of the Family Homelessness Initiative follows in the tradition of other groundbreaking research initiatives about family homelessness, the most recent of which was the Family Option Study. So to lead a discussion about the relationship between these two important studies, it's my pleasure to introduce Joy Moses, the director of the Homelessness Research Institute at the National Alliance to End Homelessness. Joy, thank you so much for being here today.
Thank you, Colin. Thank you for inviting me and for giving me this great opportunity to have a discussion with two researchers who I have the pleasure of working with on the Alliance's Research Council. Deborah Brogg of WSTAT is being welcomed back into the conversation from earlier, and we will also be joined by Dr. Jill Kaduri of Apt Associates. The topic of our conversation, as Colin mentioned, is the relationship between WSTAT's evaluation and Jill's work with the Family Option Study. I just want us to be able to jump in and get as much as we can from the conversation. So I'm going to start with Jill and ask her to provide an overview of family options and give us a sense of the methodology for that study.
Thank you very much, Joy. And I want to thank the Foundation and Deb Brogg for inviting me to have this conversation, talking about the Family Option Study, a subject that I'm passionate about. This study was sponsored by HUD's Research Office and conducted by a big team at my company, Apt Associates, led by my colleague, Michelle Wood. Now, as this slide shows, the Family Option Study actually was an experiment, given the nature of the question we were asking, which is which of several options for getting families out of homelessness was the most effective compared to what we call usual care, which is leaving people to figure out their own way out of homelessness. So we were able to randomly assign 2,300 families in 12 places across the country. None of them was in the Pacific Northwest, but we do have Western sites. And we're basically studying the same population as Deb's study. These were families who had been in shelter for at least 7 days. They were very poor. They had a lot of psychosocial challenges and barriers to housing. And as is the case in the Westat study, we have a racially and ethnically diverse group. So we assigned these families either to get usual care, figure out their own way out of shelter, or to get a long-term housing subsidy, which was usually a housing choice voucher. It was almost always a housing choice voucher, rapid rehousing, or transitional housing, or usual care. And then we followed them for 3 years. We measured their outcomes at 20 months and then at 37 months. And we measured a whole bunch of things, which are essentially the same outcomes that Deb was measuring in the study, that instead of looking at particular interventions and what their impacts were, was looking at the effect of systems change. What happened before the systems change that we've heard about all day today was implemented in the Puget Sound area and afterwards. We also collected detailed data on costs from the providers of the interventions and also from the emergency shelters.
Deborah, would you like to add a little to the conversation about the comparison between the different approaches of your studies?
Sure, just a little, because I think Jill really did it nicely and people heard me this morning. I think because our focus was on a system, it's a little bit different. We encompass most, I think all of the housing approaches that were studied in family options are included within our study as part of changes, going from shelter and transitional to now a portfolio of approaches. And we're able to look at some of those. When we look at some of the individual ones, it's a little more exploratory because they're assigned to that based on need, not based on a randomized process, but it still gives a little bit of insight. So we're able to look at things like rapid rehousing and through diversion. It is interesting, I think, because we both have been doing this a long time, we did use a lot of the same measures. We look at the research that's done before, so we both built on that, and I was able to build a little bit on their research in doing this. And when you look at the composition of, if you have the characteristics of the families in their study and our study, they're almost the same. It's amazing when we look at that. It's very, very comparable. So it's nice. We're able to really do some nice comparisons across. Our study was a quasi-experiment. Of course, it was an experimental study, but we did a number of statistical analyses to adjust for things, but also to where we couldn't control to explain if there were differences. So we have understandings of where, like I said before, with some of the cohort differences and secular trends, how that may affect some of our outcomes. So where we couldn't control, we had a lot of data to be able to allow us to explain. And we will also have a cost study. It'll be different because it won't be on each intervention per se, although we'll be using those data to say someone's experience in the system pre and post, what did that cost? What's the difference when we have the after the systems are formed? The only other thing I'd mention is that one thing we do have, which is nice, that adds a little bit, is that we did do data collection at 6, 12, and 18 months. So we were able to see some of that early jump with families, some of that early change, which was helpful formatively, but also just helpful to understand more of the trajectories of families. Sorry, stop there.
It's okay. So the next topic I wanted to shift to is the all-important one with research, is what were your findings? I'm going to start with Jill. What were the basic findings of the family option study?
Well, the big finding, the really impressive finding, is that being assigned to get a long-term housing subsidy, to get access to a long-term housing subsidy, almost always a housing voucher, had tremendous effects on reducing families' returns to homelessness, reducing other measures of housing instability, doubling up, frequent moving. And it also had other effects on family well-being. So I heard earlier this morning, helping families thrive. Well, what we found is that having access to a long-term housing subsidy improved food security, had positive impacts on several measures of adult and child well-being, including child outcomes such as not changing schools often and not having not missing days of school. So being assigned to transitional housing, our findings there really validate the systems change that was implemented under the leadership of all the people we've heard from today, de-emphasizing transitional housing. Really, what our study showed is that being assigned to transitional housing to make you ready for housing really had no effect. It did not prevent returns to homelessness, and it didn't have any effect on any of these other measures of adult and child well-being. Now, rapid rehousing also did not have any effect on lowering the number of days that people experienced homelessness during the ensuing 3-year period. It did get people out of shelter faster, which is one of the objectives of rapid rehousing. It reduced the number of days they remained in emergency shelter, and it had some slight effects on adult and child well-being. Now, a powerful finding of the cost study is that keeping people from returning to homelessness and having all of these other radiating effects only cost 9% more over a 3-year period than essentially doing nothing. And this is fundamentally because our cost study showed that emergency shelter is extremely expensive, emergency shelter for families. Rapid rehousing did cost less than usual care. And again, one of the reasons that communities across the country have turned to rapid rehousing is that it's very expensive. Not only is it extremely bad for families and particularly for children to have them be in shelter, but it also costs a lot. And rapid rehousing, shortening those stays in emergency housing saves money, as well as being better policy in other respects.
So Deborah, could you talk a little bit about the Family Homeless Systems Initiative and how it compared in some of those areas that Jill mentioned, like rapid rehousing and time homeless, et cetera?
Sure. What we saw as the system as a whole had changes that I mentioned this morning of getting people into their housing quicker, more got into housing and more got in more quickly than had just shelter and transitional. We have been, we're just about early next week, we'll be posting our 30-month results. And that was a more exploratory study looking at the rapid rehab folks that went into rapid rehousing versus shelter. And we have a somewhat similar finding that Jill had, but maybe a little different. We do find that they're comparable when we look at 30 months, 70% of both groups are in their own housing. But what we find is the rapid rehousing getting quicker and they stay. And we also find that they are much less likely to have a Section 8 that's helping them at that time, or which we didn't know till very recently going through. The folks in the shelter, I think, are 4 times more likely through, I don't have the numbers in front of me, maybe 3 times more likely to have a subsidy there. So the rapid rehousing is still kind of giving some families that ability to not only get in, but they're staying in by getting other housing, not necessarily the same housing, but they're staying stable. So that's one of the findings that I think is very comparable. And we find also that not only in our cohort 1 before, but even after families got transitional housing, they tend to have less ability to get into housing later. We don't know if it's who's being selected at this point. But when we control in factors, we still see having received transitional versus rapid rehousing delays their entry, or they don't get it in the time period we're tracking. So I think it just puts another factor there. The other things I would add at the bottom of this slide of other key factors, we, in addition to finding a focus on after the cohort difference, we did find other individual factors that affected whether someone was stable or not, or had positive housing outcomes. And I think those are important to understand. We do believe that some families with human capital have greater probability of staying in. That finding was there. And we had a very strong finding for the housing subsidy, which is important. That came through. All else, looked at, housing subsidy was important. And then several characteristics or background features for families and their composition that are important to consider.
So I'd like to make a couple of related points, and one has to do with racial equity. I mean, we did have a big enough sample size that we were able to do what's known as subgroup analysis, analyzing the impacts of these interventions separately for different racial and ethnic groups. And we found that Black families and white families essentially had the same impacts, that Black families were able to use their housing vouchers at just as high rates, and having access to a housing voucher prevented returns to homelessness and other kinds of housing instability at just as high rates as it did for white families. We didn't look at factors influencing outcomes in exactly the same way that Deb did. But again, we did split the sample in a couple of different ways into people who had substantial psychosocial challenges or less substantial challenges, and to people who had substantial barriers to housing, such as histories of eviction, and those that did not. And interestingly, we didn't really find any difference. I mean, we were looking is to see whether there's a group of families that maybe does need transitional housing, or maybe does need something more than a housing first approach. And we didn't find that.
Yeah, and evictions has come up as a very strong factor in our data. And we've just been poring over all our qualitative data, and it's corroborated by the qualitative data, just in terms of a real challenge for people, even when they get, being able to have a landlord take them in many ways, or that they get into poor housing because they go with where somebody's not doing a background check, they can get in.
Deborah, were you able to measure racial differences and note any differences between racial and ethnic groups?
So we were able to look at Black, African American, and white, and we have very comparable findings to Jill on that. We did get a finding that says folks that are multiracial have more positive effects than whites, and we're not quite certain what that means. And we did find, I think the other one that is important is we did find that families who identify as Hispanic or Latinx have greater difficulty accessing permanent housing. And we want to delve a little bit more and try to understand that, because that's a finding that's come across multiple outcomes of the housing outcomes.
So you've expressed some agreement on or some similarities in the race equity findings and definitely the transitional housing findings. Maybe we should talk about areas of where the studies, more areas where the studies differ. I guess this is a question for both of you after reviewing each other's work, which I'm sure you have. What conflicts did you note, or what differences between the two that you think are important for us to discuss?
How are you? Do you feel like it's
I
think mine took like 3 hours that day, and mine was not nearly as deep.
I think
someone has unmuted their line.
Maybe they have a point. I think I do think they're very much complementary on almost all aspects of particularly the outcomes. I think where Jill and I have talked, where we're a little bit different, I think is some of the individual factors that we see that we think are important to consider in terms of particularly, I think, human capital, although I think many people still are underemployed or maybe not have it. It doesn't mean that they don't need a subsidy, but we do see that having more human capital and growing over time does boost outcomes, does have a positive relationship to the outcomes that we saw. So we think that that's an important thing, as well as some of those other characteristics I named, like the evictions and the family size, that they may be important considerations for systems to look at to see if families, if they're struggling, if those are areas they need more intervention to help, particularly in getting access into the market.
Well, we, again, you know, as you have, we have a gold mine of data here, and we've done a fair amount of additional analysis. And we did some non-experimental analysis of connections to the to work and the labor force. And what we found is that this group of families who were found in emergency shelter, fair number were working, many were not. At 20 months, a fair number were working, many were not. At 37 months, the same, but they were different families. And they jumped all over the place. Some were working at baseline, then weren't working at 20 months, then were working again at 37 months, and every other pattern. So these are our families with really tenuous connections to the workforce. Their incomes went up somewhat over this period, but not that much. You know, not enough to even begin to raise their incomes above the poverty level.
And I think we saw a little more of a continuum of families, that there were some families that I think did actually work the whole time and were able to make more of it work, but there are a lot that struggled as well. So I don't want to say that's all, on average, it's everyone, but it was a factor for some boosting. And looking through some of the data, you know, some of it was a real struggle for people taking multiple jobs, working more hours to make it meet. And some single moms can't do that. They, you know, we had several say, I need to get a second job, but I can't. You know,
Yeah,
so I think that this issue of gender equity again comes back into play of, you know, not being able to do it.
And we've done another study, a non-experimental study of rapid rehousing. We're just completing that study, and you can find it on the HUD user.gov website. And that included some very interesting ethnographic work in which we followed a few families over time and learned what their experiences were. And what we discovered is that childcare and transportation are really major barriers to working for these families. They were their rapid rehousing case managers were connecting them with employment and training programs, but those employment and training programs were not leading to work because their cars broke down, their childcare situations weren't stable enough. And so, you know, so going back to some of the fundamental causes that we've been talking about homelessness, there are simply structural problems in the way our economy works for the lowest wage workers that we're going to have to do something about if we're going to stop inflow into homelessness.
Agreed. And, you know, many try to rely on family, and family's also stretched and has challenges. And we saw a number of that, you know, number of the initial crises that would happen is, you know, daughter has a crisis, moves in with mom, then mom has a crisis, and then there's nowhere to go. So that the family, you know, being able to use family to help in some of those times also is straining. So I agree with you. We found much of the same issue, but I think a lot of it is are resource issues that families have that just keep them down.
So and turning back to kind of the headline finding from our study, which is that a housing voucher gets you out of homelessness. And we also have evidence from other studies that a housing voucher prevents you from experiencing homelessness in the first place. You know, I'd like to turn to what I heard David Wertheimer say at the beginning of the day, which is that government has a role. And in this case, government, I think, has a role in funding long-term housing subsidies, expanding the housing voucher program, since we have this powerful evidence about how important that is for preventing and ending homelessness.
I agree. I mean, the first system study I did back in 1990 found that to be the case, that, you know, people that got subsidies stayed housed. I think, and I think in this current study, though, what's interesting is it wasn't the focus of what we had, but it came up as a very strong variable or predictor on its own.
Yeah.
So
And
I would not disagree with your finding.
Right, and in some sense, that's not a surprising finding, that giving people a long-term deep housing subsidy is going to keep them out of homelessness. I think what was new were these radiating effects that housing vouchers had on things like child separation, the mental health of adults, substance abuse. This is all quite new as far as learning about those radiating effects of having a long-term housing subsidy.
Yeah, I think you have touched on, or somewhat touched on this next question, but I want to connect it to the conversation you just had. Obviously, there's a need for permanent housing, but there seems to be a shortage of availability of that for right now. Hopefully that will change soon, and there's plans to dramatically expand access to subsidies. But what do you take from your two different studies about what we do in the meantime for families that are waiting for those options and are homeless in the moment and are being placed in rapid rehousing or other programs?
Well, I would just say again, I think the portfolio approach that the systems are taking makes some sense to me in terms of where there are opportunities for diversion to be able to serve as many families as they can, but effectively. So if there are families that only need a down, and there are families that say, we just need a down payment for the house. I'm working, but I don't have that money. And then I'll continue to accrue debt if I don't have that. That makes good sense to give some flexibility to that for other families that can get in. And I do think some of the things that we're seeing are consistent barriers for families are probably areas, I know they're often part of the assessments, but there may be certain things that can be done with a little bit more care. If a family is a family that has 4 kids or 5 children, maybe there's more assistance they need. If they haven't had much experience in housing, they need more assistance. If they've got these evictions, what sort of other help? And I know there's some out there, but it looks like they need more for that.
You know, and I would also say that what we're finding, we did some further study of how the families in our study used housing vouchers and what made it relatively harder to use them than not. And one of the things that really stood out was a history of or current self-reported substance abuse. Particularly for white families, really not for Black families, having substance abuse challenges really was the one thing that tended to impede the people who got priority access to a housing voucher from being able to use it successfully. So I would say that homeless services systems need to think more about making sure that behavioral health services are strongly tied into their programs of diversion, rapid rehousing, and and the full menu of programs that Deborah has been talking about.
As we approach the end of our session, I wanted to ask you to specifically speak to implications of both studies. I think in discussing some of the findings and some of the other issues, we kind of started down that road, but if you could say more about what lessons are there for policymakers or service providers in the work that you did, and even if you want to say a little bit about other future lines of research that should happen so that we could learn even more, that would be great.
Well, one of the differences from one of the things our study really did not focus on was diversion. These were families who were already in shelter at the point when we found them and asked them to be part of the study. I've heard a lot of very interesting things during the day so far about diversion. I think that's a whole area in which we should be doing more research. What are the most effective diversion models? What kind of feeder systems you should look to for identifying families who need help because they're about to tumble into homelessness if they don't get that sort of help. And then which of the interventions, which of the kind of the program models for diversion are the most successful.
I'd agree with that. And I would say that one thing we were not able to do, kind of evolved in the systems, is looking more at that coordinated entry process, looking more about how decisions are made and how people are mapped to them and then how that works out. We weren't able to do that to the degree that I think would be helpful in understanding that the role that plays in different systems.
Wonderful. Any last words in our couple of seconds left in this session?
Now I encourage people, you have the reports up there, to look at both studies, because I do think they both have implications for communities and providers. And I just think, it's, back in the Clinton days, what was it, the economy stupid? I still think it's the housing. Housing matters. And that's really, people may need other services to help you, but for the vast majority of people, it's having housing that's affordable. And you'll hear any parent every family you talk to, they need housing. They just need the housing. So the sixth pillar that David talked about.
That's it.
That's it.
So thank you both. It was a pleasure talking with you. I know, Deborah, you're going to be in one of the breakout sessions a little later, so the conversation can continue. And thanks to the organizers as well.
Thank you.
Thank you, Joy.
Great. Well, thanks so much, Joy, Deb, and Jill, for that rich conversation. And it's great to see that there are a lot of terrific questions that unfortunately we weren't able to get to during your session. So encourage everyone who had questions about this discussion to come to the evaluation breakout session. So, okay, everybody, it's lunchtime. We're going to take an hour off and be starting right back at 12:45. But I really want to tell you before you log off that you're not going to want to miss the sessions after lunch. We're going to dive into further discussion about racial equity, affordable housing, and homeless students. And the breakout sessions are going to be great. So really encourage you to enjoy your nice long hour-long lunch break, but come on back right at 12:45. And as before, you don't need to touch anything on your computer. That way you'll stay logged in, and we'll see you back at 12:45. Thanks, everybody. Well, welcome back from lunch, everybody. I don't know if others had the same experience, but my kids sure were amused when I sat down at the lunch table wearing clothes that they haven't seen me in about a year. So a lot of laughs around the table about these clothes. There's going to be a whole generation of kids who grow up thinking it's very strange to see their parents in anything but a t-shirt and sweatpants at work. So our next few panels before the breakout sessions focus on topics that, in retrospect, we wish we had centered more explicitly when we launched our strategy back in 2009. And the first topic is that of racial equity and housing justice. And for this panel, I'm very excited to hand the mic to my good friend, D'Artagnan Calaman, the Director of Justice Oregon for Black Lives at the Meyer Memorial Trust. Until recently, D'Artagnan served as the executive director of Building Changes, where we had a chance to work closely together. And despite his misguided allegiance to the San Francisco 49ers, he did an amazing job leading Building Changes. And I'm happy to see him here today. So D'Artagnan, over to you.
Thank you, Colin. I guess I should have expected something about my beloved Niners. I should have known that was coming. So good afternoon. Thank you, everyone. Appreciate the opportunity to be with you all this afternoon for this very important conversation. I hope you all had a good lunch break, and welcome back. As I mentioned, it's an honor to moderate this next panel discussion focused on racial equity and family homelessness. As Colin just mentioned, and as you heard from other presenters today, this was not always a focus of the FHI project, Family Homelessness Initiative, but has been a developing focus over the past several years. It's my pleasure to introduce you to Amanda Nderi from Funders Together to End Homelessness, and Mark Dones from National Innovation Service. I'm going to ask them both to introduce themselves, and then we'll jump right in. So Amanda, if you don't mind, go ahead and introduce yourself, and then we'll turn it over to Mark.
Hi, everyone. Good to be with you. I am the CEO of Funders Together to End Homelessness. We are a network of over 250 foundations, United Way's corporate giving programs, and individual philanthropists committed to preventing and ending homelessness with an explicit lens around racial and housing justice. And we have been on a journey. I've been on that journey with Mark, and I'm very excited to get into the work of not just reimagining philanthropy and how we have committed to that, but decolonizing our systems of funding that have led us to some of these inequities.
Thank you, Amanda. And Mark.
Hey everybody, my name is Mark Dones. I use they, them, theirs pronouns, and I'm the founder and executive director of the National Innovation Service. We are a systems transformation shop focused on the redesign of public systems to better serve historically marginalized communities. Our lens is explicitly justice oriented, so we think about the transfer of power from historically white supremacist and white dominant systems towards communities of color. And we, in thinking that through, recognize and talk quite a bit about how systems of justice have already been developed in the margins, right? And we really need to be thinking more about how we invest in and uplift the creations of those communities rather than try to build new stuff.
Thank you, Mark. I appreciate you both for your brief introductions. And so with that, I'll go ahead and jump in with our first question, which will be coming to Mark. So Mark, in 2018, you facilitated a national summit on race and homelessness in Seattle, one of the first major meetings of its kind in the country. You also authored the Spark Report, I think as many of us are familiar with, one of the most detailed analysis of racial inequities in the homelessness sector to date. How much progress do you think we've made since then? How much progress do you think, or what were the successes that you saw coming out of the summit and that report? And then also, thirdly, what do you think needs to be our focus today?
I love one question, but 7 questions. So I think that if I start to think about just like what progress has been made, I want to disaggregate types of progress, right? So I think that there is conversational progress and there's material progress. And I think that on the conversational front, there has been significant progress, right? I don't think when I really started doing deep work inside the housing and homelessness space around 2015, it was unimaginable then, right? That we would have started a convening put on by the Gates Foundation with national leaders from around the country with, you know, Colin and David saying like, it's the racism, right? That was not a thing, right? And certainly leaders like Colin and David were having some of those conversations, but we as a field were not having those conversations, right? And so I think the success of the Spark Report and of efforts by others, including obviously Amanda, have been largely in driving substantive shifts in the conversation. It is now not weird to say like, homelessness is the direct result of structural racism, right? I want to also note briefly a shift in thinking. I want people to start noting that all racism is structural. Saying structural racism is in and of itself a little bit of an oxymoron, but we can get there. So the purpose, though, right, of my work and of others' work is to get to material changes. And on that front, I'm sad to say, not so much. And that, I mean, like that's the journey of progress, right? Like we talk about it and then we start to move. But I think Amanda and I have had many conversations every day for the last 5-ish years. And like recently we were having one, we were just sort of like, who's Black and running stuff, right? Like literally just trying to be like, who's Black? And like it was so easy to come up with those names, right? And it's because we actually haven't done the material work of moving power towards those historically marginalized communities and towards people with lived expertise. I think that the other thing that I would say in terms of sort of trying to remember all the questions you asked me.
I would just add, so, where do you think are the successes that you saw coming out of the summit? And then secondly, I think you've already talked a little bit about it, but what do you think are the things that we need to be focusing on today?
Okay, so success out of the summit, I think, right, like, again, was a migration of where the conversation was happening. And that I think is also important, right? So the summit migrated the conversation out of a realm of researchers and of people who are already paying attention to racial injustices, right, into philanthropy and community in a very different way, right? And I think that some of the folks who I've already seen participate today from Snohomish and from Tacoma, right, we're at that summit. And I think really, right, like have taken the banner of doing that work and of deepening the work of building racially just responses in community from that day forward. I think that if we need to talk about what needs to be done, right, like what remains to be done is the substantive material work, right? One of the things that I have been really keen on saying lately is just like, listen, like white supremacy means, dismantling white supremacy means white people don't make all the choices. Like that's actually what that means. And like you can dress it up to be like 1,000 other different things. You can like talk, but like we're talking about the movement of power from white people to non-white people. And until we actually see that happening, we're just, sort of doing this, frankly, colonialist, extractive, knowledge-producing practice that is about like how smart we can be about racism, and it's not ending racism.
Thank you so much, Mark. I appreciate your thoughts and words there. Amanda, so following up on Mark's comments, how should a focus on housing justice change our thinking about homelessness? So I'll start off with that question and I'll come to a second part of that.
Yeah, thank you. So I just want to first just acknowledge Mark, because without you and the work of Jeff and the Spark study, as you said, but I want to put a fine point on it, we would not be here explicitly talking about racial justice, being able to distinguish and name that it's not about race. There's nothing wrong with being Black, it's about racism. And naming things like white supremacy and government sanctioned racism. A lot of folks were talking about it in their community. Of course, Black and Indigenous folks were telling us, but you led us to this point. And so I just want to acknowledge you for your work and your partnership. So I think for a long time, we know we've lived in the equality frame. We've started to move to an explicit equity frame. But the reality is that our work still centers on a problem analysis and not on a power analysis, and that is justice. And Mark alluded to that in their remarks, but I feel like that is the central focus, right? The racial equity work is important, but the power dynamics that exist moves us to justice. And so I want to put us in a position of thinking about what does housing justice look like in the future. It's Black History Month. The movement for Black Lives has declared it Black Futures Month. So let's live in the future of what does justice and liberation look like. And for me, it actually looks like dismantling the premise of this conference. And I say that in love and care and grace to our deep partners who started Funders Together. So know that like, I know why we're here. But if we're talking about Black futures, we're talking about a system that does not need to research and design around and research and question again and again and again and again what the community has been telling us their experiences are in a system that is fundamentally racist and rooted in white supremacy. So we don't need the studies, the 10-year-long studies, to tell us that people should have the power that they rightfully deserve, and they should have the resources. It's not about like what type of housing intervention. It is just about housing. And it baffles me sometimes that we over-research and over-discuss the need to just actually move resources to people so they have agency and power over where they live, over what their community looks like. And that we're not coming to this conversation ever talking about reparations and repairing the damage that's done. That's the only thing actually that we maybe need to spend time researching, is really getting clear, not researching in the sense, the traditional sense of researching, but listening to communities to understand what we need to repair in the system that has hurt people in long historical ways. Other than that, we should be moving to a conversation that says housing is not just a right, housing is a fundamental entitlement of a healthy community, and just give people their things, right? But I know where we are in reality, and I'm not like trying to move us away from that, but we should be thinking about the future where these conversations don't need to happen because we're not trying to convince someone of someone's humanity. And that's essentially the systems and powers and structures that we've set up, is constantly measuring, convincing, analyzing someone's humanity to be able to obtain housing, to stay in housing, to live in a certain neighborhood. That is not justice, and it's certainly not as liberation.
Thank you, Amanda. Let me ask a follow-up question to you, and certainly accept Mark if they want to jump on, certainly jump on in on this one. So as you talk about, Amanda, the shifting of power, which I think is right on, what are your thoughts about what that looks like? What are the tools and things that we should be thinking about? I assume some of that is simple. Some of that may be more complex. And so I'm just wondering what your thoughts are there, Amanda, and certainly Mark, feel free to jump in.
So I think that has come to bear in this pandemic when we think about, I don't know that I want to think about tools. I want to think about like changing the way we do things. And the discussion that we're having right now about how to support people in housing, and the discussion that we're having right now about like things like cash transfers or things like mutual aid funds. And so to me, the only tool we need is how to shift away from the layers of gatekeeping that say that you have to prove that you are in a housing crisis, that someone has to fill out a form on your behalf, that a nonprofit has to vouch for you, that nonprofit then has to pay that person, that the decision is made that you only get to pay your rent and not pay for other needs. Like, so when I think about the tools to get there, I think that we could, and Mark and NIS has done this work, we can create better racial equity analysis and decision-making tools. And the work that NIS is doing with the National Alliance to End Homelessness and Center on Budget to like help communities figure out how to spend these dollars equitably. Those are the right tools to start to get us closer to racial equity. But when we're talking about justice And we have to talk about how to spend money in very specific ways. That's not justice. That's that to me is not extracting the things that are oppressing people from actually being able to support themselves. And in fact, the conversations we had earlier about prevention, we start to shift our thinking and our work to not how do we end homelessness, but how do we ever prevent housing insecurity from happening? That's when we start to move away from these like tweaking around the edges of the system and really fundamentally reimagining it.
Yeah.
Thank you, Amanda. Mark, go ahead.
The only thing that I would add there is, so one, I have a vision for systems across this country where, to Amanda's point, right, like prevention is response is permanency. They're all the same things if you actually listen to people, right? The differentiation in what we offer at those different moments and what we consider the span of the experience of homelessness are in fact dictated by what we think is appropriate, not what people ask for, right? At all stages in those moments, right? Prevention, experience of homelessness, stabilization, people are asking for the same stuff because we are like power drunk on white supremacy. We means test people at each of those spaces. And that in turn gives rise to us doing different things, right? But in fact, if we step back from means testing, which it means, right? Like we actually say we are stepping back from power and saying like the power lives with the person asking for something, not with us. And so at each one of those points, when someone asked for something, we would simply provide it. And there's a way to do that, right? And I think that like what people often say to me is like, well, we don't have the money. And I actually think we do have the money. And I'm going to be brutal here. We put that money in services that people don't ask for. And in fact, have said repeatedly don't want. And instead, right, of doing the things that people ask for, right, which is saying like people ask for money for housing or for the housing itself, right? We have built out a service architecture that actually is not in line with anything that people need. And frankly, if you look at the data, right, like we talk about wanting to be a data-driven culture, if you look at the data, only about 15 to 20% of people experiencing homelessness actually have complex needs, right? And so we've built a system as if that number is 80%, and it simply isn't, right? And you could actually convert the vast majority of those service dollars into either vouchers to place people in empty spaces that are currently existing, right? Or you could use that money to convert your shelter system into an emergency housing system, right? And that's some of the work that NIS is working on right now with our partners across the country, is thinking about what it looks like to have emergency housing rather than emergency shelter. But all of that, right, like is rooted in a fundamental belief that what people ask for is the right thing to provide, and there is no shorter pathway to justice than that. Particularly when the people asking for it are Black, Brown, and Native. Let's be clear.
Thank you, Mark. Thank you, Amanda. So I've got another question for each of you, and whoever wants to jump in on this first, feel free to do so. So, as you know, we are in the early days of our new administration where it may be possible to make more progress against homelessness than over the previous 4 years. So what specific opportunities exist within the Biden administration, and what should we be prioritizing?
I'll take this. I don't think it's just the last 4 years. The reality is like, it's forever and the last 12 years. And I've been thinking about this a lot. I think people thought that having the first Black president for 8 years meant that we would have policies rooted in injustice and equity. And what I hope that especially white America understands is that the first Black person to do anything usually can't touch the issues of racism. And that's largely because we are just not allowed to be our authentic selves. And we always usually have to build up to something in order to get things done. So I just want to name that and put that in the room. And so the opportunities we have now in this administration are because we had, 4 years of basically like white supremacist terror and a long overdue racial awakening that was due to people being home and being forced to see the public lynching of Black men. So I also want to make that clear, right? That those opportunities to now make what I think are incremental changes on the road to justice happened at the hands of white supremacist terror, okay? And so, but they are opportunities, right? And I do have hope, because the first week, what we saw was an administration who put out an executive order for the whole of government, right? Not just individual departments, but for the whole of government to think about equity and justice. And I think the opportunity there now is to take what we had been doing the last 4 years under the leadership of terror, when we were some ways like retreating, but also like coming out in full force and saying, no, this is what it looks like. We've been doing equity work in our communities for the last 4 years, despite the last administration. And so we have an opportunity to name the future state that we want to see and figure out within this administration, what does it look like to center policies that don't just try to go around fair housing, but think about repair of communities who've been strategically disinvested in because of government sanctioned racism. Like, I think the opportunity that we have is actually to change the narrative around what got us here, and to think about actual resources that will repair the harm. Like, I think we could get close to reparations within this administration. It won't be packaged like that, but I think we could get close to it if we actually name what got us here and we start to do the work from there.
I'll just say briefly, and I think this gets back to something you asked me earlier, like, what would I have done differently if I could go back to 2018, I think it was. So the Spark work and the work that I've done in the field has largely been about measuring disproportionality. And as a social scientist, I'm proud of the work, right? As a social scientist, you also like move on from your work and like critique it. And there's a problem with using disproportionality as the central measure of whether or not a system is equitable, right? And the core issue with using disproportionality as the central measure is that it doesn't actually get into harm or suffering, right? I theoretically could build a system that flattens disproportionality, but what that could look like is everybody suffers equally, right? And that's actually not good. And when we look at like quantitative measures of whether or not a system is performing equitably, we do need to understand whether or not people want to use the things we build, right? And I think that at the core of what was missing from the Spark work is I traveled the country listening to Black and brown people tell me how much it hurt to try to get something out of these white supremacist systems. That doesn't actually translate into a number. And like at the end of the day, if you build something that you say helps people, but all it does is induce suffering when they touch it, you're not actually helping anybody. And that's what's missing, right? We can't continue to have conversations driven solely by disproportionality and call that equity work. And that actually is the problem with all of the health equity framing, right? We understand how to measure statistically probabilities about who's likely to have a worse outcome, but we don't actually understand the suffering that exists when you walk around in a body that looks like mine and try to get help from a system that was built by white people. Full stop. And so if we're not able to have that conversation, not just in this administration, but period, then we are not having the right conversation. Which also gets to power moving, right? Like, so I, like Amanda, right? I don't think it's just about the Trump glad we survived the first incursion of American fascism. It won't be the last. I hate to break that to you. And maybe we won't survive the next one, to be honest. But we got through it. But like what we have to think about in order to stave off the next one actually is to recognize that it was possible only because we have failed to move power out of these white supremacist systems. And it is only, right, sheer grit of people organizing in the margins and the things they had already invented, right, that allowed us to survive the past 4 years. Which I think leads me to like the last thing I would say, which is just like, we have to start, like there's an authenticity to Amanda's point about, you know, when you're the first Black person, you don't get to really be who you are because you're the first Black person. This is a new thing for me that I'm doing where I'm telling the truth. Like, so my family was house poor for the majority of my teens, right? Like things got repossessed from us on the daily. Like we hid from repo men. That was just a thing that was like part of my experience. I experienced housing instability when I lived in New York. I couch surfed for a while. And like, these are not things that I've ever talked about because I was so focused on building my reputation as a researcher and a policy strategist when I could have told you the things that I know now in 2009, right? Because I lived them already. But I was so focused on not being written off, right? As the lived experience Black person. I knew, right, what lived in that space, which is a different kind of marginalization, but a marginalization nonetheless. And so if we're not actually able to see, right, that inside lived experience, lived expertise, whatever you want to call it, is also a different kind of brilliance. Like people with lived experience are not just people with lived experience, right? They are me, they are social scientists. They are, I know a person who became a perfumer, right? Like we have lots of like different talents, interests, abilities, but we're not able to authentically show up as ourselves because even inside these new spaces that we've created where theoretically that is possible, it's really just new kinds of marginalization. And that actually has to stop. If we're not able to authentically be who we are, the totality of who we are, then it's no different than what it was before.
So I want to name, because I know we're running out of time, the opportunity practically that we do have in this administration, and that for those who are listening can do. We can change who has access to this administration. We can fundamentally change who is in these conversations, who is now virtually in the room at HUD or at the White House, by the folks that are in power, who are mostly white or living in white supremacy culture, giving up that power, sharing that power, and making sure that this administration is hearing from community, is hearing from organizers, is hearing from people who might do housing work, but maybe don't do housing work, but housing is fundamental to the criminal legal system reform or health equity reform. So I think that's something practically, is that in every step of your work, as you are engaging with the administration, as you're engaging with your local elected officials to think about how to influence this administration, can you step back and examine the power that you are holding, whose voices are at the table, and shift that dynamic? And that's the actual opportunity we have.
Thank you, Amanda, and thank you, Mark. Sorry, we're muting everyone, so it's taking me a second to get off mute. So, Mark and Amanda, I want to thank both of you so much for your words. Absolutely inspiring, aspirational. Certainly, you all have been wonderful national partners for all of us, and especially here in Seattle. I just cannot thank you both enough for the work that you have brought to our community and across the country. So bravo to you both. So just as a reminder, we will have Mark and Amanda this afternoon in our breakout sessions. And so if you have further questions, I want to encourage you to attend our breakout sessions this afternoon. And with that, thank you so much. I appreciate the time, and I believe we now have a video coming up.
My name is Daniel Zavala, and I'm currently serving as the Interim Executive Director at Building Changes. Building Changes is dedicated to advancing solutions for educators and schools to help those who are most disproportionately impacted by student homelessness. specifically students of color and their families. Student homelessness directly impacts more than 40,000 students across this state. And what we see are huge disparities in academic outcomes that exist between students experiencing homelessness and their housed peers. Importantly, as we think about those disparities, there are also large disparities as it relates to race and ethnicity. Through the Family Homelessness Initiative, we were able to kind of expand beyond the homeless response system to work with health, education, employment to focus on the whole person, to ensure that not only was stable housing provided, but all of the other elements and aspects of a person's life that must be met. Quality education, stable employment that provided family-sustaining wages, access to quality healthcare that ensured that people could stay healthy, were all present to meet the needs of people that were experiencing homelessness across the 3 counties. I invite and welcome all of you to attend the next session on student homelessness, where you'll hear from the experts who are actually working directly with schools and other educators to provide services to students experiencing homelessness. In that session, you'll hear from Maret Tekle Arawan, who is the Education Strategy Manager at Building Changes, and she will moderate a panel that includes Joseph Saya of the Pacific Islander Community Association of Washington, Tyra Williams at Seattle Public Schools, and Dr. Matt Smith of the Office of the State Superintendent for Public Instruction.
Thanks so much, Daniel. Schoolhouse Washington has done amazing work over the past decade improving academic outcomes for homeless students. And I particularly want to recognize the leadership of Casey Troupin at the Rakes Foundation and previously with Columbia Legal Services. Casey has done incredible work advocating for homeless students throughout his career, and none of this work that Daniel described would have been possible without him. And for our final panel presentation of the day, we wanted to dedicate some time specifically to the topic of affordable housing. You know, one of the themes that keeps coming up, one of the problems that we keep encountering in our work around homelessness is this discussion that amazingly still is one that we have to have around whether or not homelessness is due to individual failures or deficiencies, or whether it's due to systemic problems within the market, within the economy, within the structure of our society. And the work that our next facilitator has been doing to really provide the rigorous evaluation that demonstrates the way that homelessness is deeply rooted in a problem of affordable housing. Greg Colburn, assistant professor from the University of Washington, is really leading the charge in making this case. Greg moved to Seattle from Minneapolis a few years ago, and he's already made a huge impact in our community advocating for the need of affordable housing. And so I'm really proud to count him as a good friend. And Greg, the floor is yours.
Thanks, Colin. I really appreciate the opportunity to be with you today. And to have been involved in this important initiative, at least in a small way, since moving to Seattle a couple of years ago. I've served on the evaluation committee for this initiative, and I've worked pretty closely with Colin on a range of issues related to housing and homelessness in our region. At the University of Washington, I study housing markets, housing affordability, and homelessness. And so I've taken a very keen interest in the good work of the Gates Foundation to fight family homelessness in our region. And as has been repeated throughout the day, this initiative has been a rousing success. The situation would have been much worse were it not for these investments and for the good work of those who were involved. And unfortunately, the scale of the problem, the inflow of families into the system has risen at an alarming rate. And the result is continued increases in family homelessness and for individuals as well in our region over the last decade. And so as a result, we have an important takeaway, which is we need to focus on our emergency response system, but we also need to keep our eye on inflow. And this observation is the motivation for our panel today. So I'm really pleased to be joined by 2 people who I consider to be innovators in this field. I'm going to have them enter the conversation now and introduce themselves and then bring them in a bit to have a deeper conversation. Chris Coe is Vice President, Impact and Strategy at the Greater Los Angeles United Way. Chris, welcome. Thanks for being with us today.
Thank you. So good to be with you all. First off, I mean, hands off to the last panel. If we were in Congress, I would happily cede my time to the gentle people of the last panel. but happy to be here. At United Way, we serve as the largest non-governmental systems agent on the work of ending homelessness in LA, and which the shorthand, I guess, is we're the building changes of Los Angeles, which we're proud to be.
That's great. And Chris has really played an important role in generating community coalitions that have been instrumental in the passage of some significant ballot measures that raised meaningful dollars for housing related issues in Southern California. And so he's going to bring a great perspective there. Our second panelist is joining us from Minnesota, Heather Worthington, who formerly worked for the city of Minneapolis and now is working for the city of Bloomington, a suburb of the Twin Cities. Welcome, Heather. Maybe Heather isn't on just yet.
She doesn't even need words.
No, she doesn't need words. Well, Heather,
her presence is
with us shortly.
beyond.
Heather's somewhat of a planning celebrity for those of you who follow this. Heather and her colleagues worked with the Minneapolis City Council to pass one of the most sweeping residential zoning changes in recent history in this country, and they eliminated single-family zoning. And this change opens up the entire city of Minneapolis to greater housing density and potentially creating more housing units that are so sorely needed. And so she's going to speak about how this change came about and the potential role that it can play in addressing the housing and homelessness crises in that city. It looks like Heather is not in the meeting yet, so I'm going to continue on with my introductory comments here. And so I'm going to set the stage for our conversation with an overview of some of the research that I've been working on recently that's hopefully relevant to this conversation. My co-author Clayton Aldern, who is also from this region, and I have written a book called Homelessness is a Housing Problem. And we're excited that the University of California Press is going to publish this book, and it should be out in the early part of next year, 2022. And the purpose of the book is to answer a pretty simple question, which is, why are rates of homelessness so high in some cities but not in others? For example, Seattle-King County has nearly 5 times the per capita rate of homelessness of Chicago-Cook County. And we believe understanding this variation is really fundamental to understanding the root of this crisis. And so as discussed throughout the day, common explanations for the crisis of homelessness frequently center on individual vulnerabilities such as poverty, mental illness, and drug use. And we do know from the academic literature that these vulnerabilities certainly increase the risk that an individual or family will experience homelessness. But the question is, if they explain homelessness at an individual level or risks at the individual level, do they also explain regional variation? In other words, are the large homeless populations in certain cities due to having disproportionate populations of people with these vulnerabilities? And we emphatically argue in our book that the answer to that question is no. We suggest that these conditions are precipitating events of homelessness rather than their root cause. So poverty in one location may produce a spell of homelessness, while in a different location it doesn't. For example, the city of Detroit has 3 times the number of people living below the federal poverty line per capita than does San Francisco, but it has 1/5 the per capita rate of homelessness. If poverty is the root cause of homelessness at a city level, Detroit should be the epicenter of the homelessness crisis in the United States, but it's not. We find similar relationships when we examine drug use and mental illness. There are not more addicts or people experiencing mental illness in Washington than in any other state, but the consequence of these conditions are more acute in certain locations under certain conditions. We find that the variables that best explain variations in rates of homelessness are the cost of rental housing and housing vacancy rates. Where housing costs are high and vacancy rates are low, homelessness flourishes, like in Seattle. In the academic literature, this relationship is known, but we hope to bring this message to the broader community in the hopes of changing the public's perception and understanding of this problem, and importantly, the solutions that we should prioritize. In sum, if homelessness is a housing problem, its solution is also housing. This does not mean that anti-poverty and behavioral health programs aren't important. They certainly are. But to get to the root of the problem, people need to be able to access quality, affordable housing. And until we address these deficits, we will continue to struggle to end homelessness. So what do we do? How do we provide access to housing for those who need it? We argue that this requires the attention and effort of all levels of government, from Washington, D.C. to state capitals to city halls. We believe that the scale of investment and change that is required can only be provided by government. Importantly, the solutions that are needed may differ based on the specific conditions of a locality. These solutions may range from homelessness interventions like diversion and housing first to affordable housing production subsidies like the low-income housing tax credit. Currently, one of the most compelling and hopefully feasible solutions is the expansion of the Federal Housing Choice Voucher Program, Section 8. Providing a rental subsidy to all households who need it could make a significant dent in the homeless problem. Evidence presented by Deborah and Jill this morning underscores the effectiveness of vouchers as a tool to fight homelessness. With the new administration, there's renewed hope for an expansion of the program, which would be a welcome policy change for low-income households and for cities that seek to house their residents. Unfortunately, for local jurisdictions, this policy change may not be a silver bullet to end homelessness for two reasons. One is the timing and the scale of the federal response is unknown. Second, the expansion of the voucher program may be a necessary but not sufficient solution in all places, given the constrained housing supply in many US cities. Therefore, local communities must continue to do the important work of generating funds to address homelessness and the associated service needs, and to create an environment in which more housing, specifically affordable housing, can be built. So I'm gonna jump now to ask Chris a couple questions, but I see that Heather is now on. And so Heather, we'd love to get a brief introduction and welcome you to the conversation.
My apologies, having some technical issues as we all do these days.
Not a problem.
Thanks for inviting me. Hi, Chris. Hi, Greg. Hi, everyone. I just have to say greetings from very, very cold Minnesota. It's -3 ambient today. So that could have something to do with it. I am Heather Worthington. I'm the principal with Worthington Advisors, LLC. We're a consulting company focusing on land use equity issues and leadership issues around changing land use in local government. So I'm really pleased to be with you today. Thank you.
Welcome, Heather. Well, Chris, I hope that you can maybe start by talking a little bit about some of the initiatives you've been involved in LA, Home for Good, for example, and talk about how they came together and how you were successful in raising such significant resources for housing-related initiatives in your region.
Sure, absolutely. Happy to do that. Thankfully, it's not 3 degrees here. And looking forward to the conversation, so I'll try to be on the shorter side. Just to recap what those 3 are. So Proposition Triple H for the city of Los Angeles is a $1.2 billion housing bond to help LA get to building 10,000 supportive housing units over the next 10 years. Measure H was a county sales tax, a 0.25% sales tax, to help create the supports and subsidies to house 45,000 people over 5 years. And then Measure J, which we just passed, it's also for the county, a 10% set aside of the general fund budget to health, homes, jobs, youth development, and reentry efforts for BIPOC populations in communities in Los Angeles, affirmatively where we want money to go to. And when I think about all of that, 3 ingredients that I would offer up that have consistently been in place for all of them, I think about kind of building a fire and the logs and the lighter fluid or the environmentally sustainable starter log and the spark to it all. I think about solutions, public concern, and political pathways. So when people ask us when we started this work, I always say 10 years ago, kind of similar to the Gates Initiative here. And that's when we really started laying down the logs of the solutions. Kind of if you think backwards from FAQs that voters would ask one day about something, all of the things you need. One, you need spokespeople and the actual people who are doing the work. And especially in this time, I think it's important and critical for those to be community leaders and community members, because in any resource tax effort, the number one question in this environment in which we don't trust government is who's getting the money. And so laying down an infrastructure and coalition of people and a system, honestly, that's led by the community pillars instead of just government systems, I think was a critical ingredient. And then proof points, doing that long enough to say, hey, it actually works. You know, it's not that if you build it, we increase the issue. No, building it's the only way we actually tackle it. And having proof points around veteran homelessness, for example, and being able to say, look, in this population, we saw it go down by over 50% when other things were going up. When we invest, it actually works. So we were doing all those things. Originally, our theory of change was efficiency. And if we get efficient with the resources we have, we can tackle the problem. Like Mark was mentioning, things that people could have, known years before was that would not be enough. For me personally, I think sitting down with the Homeless Count in 2015, after we had set up this infrastructure, done all these things, and still to still see it go up was a wake up call to say, look, we've won housing resources on the order of 100, but the magnitude we need is on the order of thousands. And realizing that when I looked at the numbers, it really struck me that any time over the years we had made a difference, it was only when we had actually secured housing resources to that level. It was eerily like 1-to-1. It was kind of a usual suspects Kaiser Soze moment that I had. So you have the logs of the solutions, but honestly, public concern is just something you can't manufacture and pay enough for. I think when we talk about laying the work or building awareness, honestly, I think the critical work of foundations and philanthropy to invest in that is critical as that piece, but you can't replicate something where everyone wakes up to it. And for us, that was the issue of visible homelessness, which that was preceded by winning and securing the rights of unhoused person to have a meaningful amount, an appropriate amount of personal belongings with them. It made people see our unhoused neighbors in a way they hadn't been seen before. And suddenly homelessness was an issue. It was the #1 issue, even in LA, where traffic or other things have been the #1 issue. And so you always have to be looking for that, and that moment is largely unplanned, but you have to be ready for that moment. And I think that's where, when you talk about political challenges, Greg, I think it's frustrating when you have a solution and you have a problem and you just like want people to act. But the final ingredient I'd give of the political pathways, without that bit, we're just going to be sitting on the sideline, waving case studies. Because one of the greatest challenges in the work, even in progressive politics, is that there's a line, there's an order, there's a sequence of things that are given, kind of this is what's next in line. And when issues come up, you're seeking to skip the line, so to speak. And to do that, you have to make the same way that the issue is made real for the general public, that you have to make the issue real for politicians. And that means working capital is critical for whatever agent is doing that, because you need to pay for polls, you need to pay for legal opinions, and then you need to really route that through a relationship and a champion you have. And so I'd say those 3 things really set up all the pieces. And if you don't have, you need all of them. I think a lot of times you're working with 1 or 2 of them. And even though we were involved in the first 2 pieces for the first couple measures, I would say even on Measure J, all credit to the Movement for Black Lives and BLM for the work they did on the coalition building for years and years, and creating solutions. We had a group called Justice LA laying down a plan called Care First, Jails Last. Again, all of those things, and then we had the summer, and then we paid for those polls and those legal opinions, and all of that, happened all in a moment. But honestly, it builds on years of the other efforts.
One quick follow-up, Chris, and then I want to bring Heather into the conversation. One of the things that I struggle with when I talk about the scale of the problem in our region is, this is not a $500 million problem. It's not a $1 billion problem. It's potentially a $10 billion problem, depending on the estimates that you look at. And that seems like a really daunting number for a lot of people. But when you actually get into budgets at the federal or state level, it is doable if we make the decision to pursue that. And so I wonder, and obviously the scale of the problem in LA is multiples of what it is in terms of absolute numbers compared to Seattle. And so when you start to think about $1 billion initiatives and people say, oh my goodness, this is massive. But as you said, compared to the need, it still is insufficient. How do you think about sizing that and communicating that in this broader message of the needs are beyond these still very robust policy responses?
Yeah, I mean, if you were to ask me how's it going, I would say it's going okay, right? We can point to all the things of tripling, quadrupling supportive housing production, and doubling housing placements, but it's completely still not enough. I think the inflow part, both in terms of housing affordability, but the underbed of our racial history in America, like those 2 things are fundamental challenges. And something I'd say we've learned from our voters is that they're not scared of numbers if it's the right answer. Like if it's something, I think they're more looking for, I think numbers are scary to voters when they seem to be made up and not tied to what will actually address the issue. And if someone were to ask, what's next, or should they do some of the things we've done, maybe, but I would say like there's the next thing. And when I think about land use and all of the other pieces where we can add up A, B, C, D, hopefully get to E, kind of along the lines of the last panel, it's like we can just skip to E. And if we have a specific case, even if it costs billions of dollars, I think if we're credible, and this is why I think UBI caught on as much as it did in this last cycle, which is that if it makes sense and if it's clear that it would address a fundamental foundational issue, then I think people are able to receive more than we had assumed. But we have to do that work of helping translate how that actually tackles the problem.
Great, thank you. Well, Heather, could you give us a little update on what's happening in Minneapolis in terms of the history and your involvement in that very significant regulatory change, and how that's playing out now that that's been announced for a couple of years? I think that would be really valuable to all the folks on the Zoom call today.
Thanks, Greg. I really appreciated Chris's comments. I want to circle back a little bit too. We did make some major changes to our land use regulation in Minneapolis, and that was really because Minneapolis realized that we were leading the nation in racial disparities, especially in things like home ownership and housing stability. And so we took a very values-led approach to doing the work and asked the City Council to set goals and values to underpin that work, to provide a foundation. And I think that was really crucial because that was an important communication tool for us as we went out and tried to engage with the residents of the community, and especially to engage with people in the community who typically were not involved in these discussions. So people who are directly impacted by housing instability or by the cost of housing, but who typically did not attend public meetings. And I think that was a major part of the sort of foundational work that we did in building support for it in the community. And that is not to say that it had unanimous support. The council did vote in a strong majority to approve it, but it has been pretty I would say kind of confrontational from the beginning of the discussion about it. And primarily what we did, the headlines were all about single family zoning. But I would just point out that we made other, I think, really meaningful changes in land use regulation in the city, like limiting or eliminating off-street parking minimums, which was an important piece in terms of the financial stability of a project, whether or not a project would pencil. We also looked at things like the use of land use regulation in terms of minimum buildable lots. And we were looking at, for instance, a minimum buildable lot in Minneapolis could have a 3,000 square foot home, or it could have 3 1,000 square foot units. That was the conversation that we were having. So trying to have a very visualized conversation in the community about what this means. And it came on the heels, I think, of, probably 10 years before that, the city really struggling with what we were kind of calling monster houses at the time, people who were wiping a single family site and then building this really gigantic single family home on it. And a lot of people weren't comfortable with that either. So there was certainly something in the air that allowed us to have that conversation at that time. Now the city is moving forward with actually implementing those changes. And one of the first ones they did was the 3 units per lot. And so we're hoping now that we'll see developers who are really interested in the issue coming forward, especially small developers, and building these either, duplex ADU, single family home with an ADU, that kind of arrangement, or subdividing existing buildings. So I think we're going to start to see some of that sort of infill redevelopment starting to happen because the regulations are changing. But it's a slow process. The market is a little bit slower here right now. It's starting to slow a little. It's been a really strong single family market, and that I think has helped the Twin Cities kind of weather this last year. But we'll see if that continues.
And having spent a lot of time in Minneapolis, something that a lot of people around the country don't know is it is home to some of the most significant racial disparities in the country, if not the most, on a range of different measures. It also has one of the lowest vacancy rates in the country. It is an extremely tight housing market. And so as we move forward, and I know you're saying it's a little bit slow, but how do you see this potentially addressing, both of those really acute issues that we observe in the Twin Cities?
Well, I think that this alone does not address those things, and this is part of a regulatory sort of start to this work that was necessary, but is not the end game. And I think a lot of people confused that early on, and I guess this kind of circles back to what Chris was talking about earlier, and I really appreciate it. I think part of our challenge in local government, and especially around things like redevelopment and housing, is that this is a very complex system that especially allows affordable units to be built and encourages them to be built, incentivizes them. And one of the things we don't do very well is we don't really show our work when it comes to sort of the intersection of regulation and finance in terms of how developers think about infill construction in particular, but think about these smaller infill lots. The old maxim in the development world is it's a lot easier to do 100 units than do 2 or 3. And part of the challenge is that when we only build 100 unit projects over and over again, what we're doing is really limiting people's access to the most highly amenitized areas in our cities. Because the intentionality behind early zoning was that we would actually put things like parks and good schools and other amenities in those areas that were considered to be desirable and were white. And I think this is the crucial part of the work that underpins 2040, is that we looked at all of those zoning laws that were established in the mid-1920s. We started to question them in terms of the amenities in those areas and the access that they provided to residents and the agency that they really built for residents in terms of their interaction in the political process and in decision making. So I think another thing that we don't do terribly well is explain that piece to our residents. They kind of see that and they get it right on a very sort of intuitive level, but they don't really understand the history of it. And groups like Mapping Prejudice, who we worked with extensively, really helped to kind of peel back the layers of that history. And I think there's another opportunity that we have to actually have a conversation similar to that about why our systems are failing some people in our communities. So we think about regulation from a land use standpoint, but we also have to think about it through a systems lens when it comes to people who are being served in human services or in the correctional system, or who are eligible for affordable housing vouchers. And we don't really do a very good job of explaining where the money goes and how it's utilized and how those things interact with one another. And so I think one of the things that we can start to talk about more openly and more clearly is the linkage between housing stability and people's personal and emotional and financial stability. And that has an enormous impact on people, especially on children. And so we can really start to make, I think, a strong case for better housing, for certainly more fair and accessible housing. And we can tie that directly to good outcomes in terms of children and other social factors that we as communities assign value to.
So one of my frustrations related to the topic of homelessness is the public skepticism about the public sector's ability to deal with the problem. And so I try all the time to say, no, we are actually having success at the public sector. We just have a problem that's bigger than the resources we've allocated to it. And so I wonder, Chris, I'll bounce to you, and then Heather, hopefully have you respond to this as well. Is, I think being able to demonstrate success, programmatic success to the public, is absolutely essential for continuing down the path, in my opinion. And I'm curious how your organizations and your communities have prepared to communicate the success or the changes that have come about as related to funding in Southern California or land use regulation changes in Minneapolis. So do you mind speaking to that a little bit, Chris, and how that plays into the way you think about this problem strategically as you move forward?
Yeah, I think especially when we think about the future, I think about, given the cultural values in America, different than where I'm from originally. I mean, where people have a built-in skepticism of government and what it's meant to do. I think if we lean into government as a facilitator and people and community institutions as actors and leaders in that, it's probably the most effective way. And to tie it back to to the last panel, like an example of what that means for us in housing feels like the ingredients are simple in two forms. Like we have a marketplace in which if there are builders and investors who, if they know someone can afford rent, they will find a way to build that thing for that person. Right now, we just have a whole group of people, most of them Black, Brown, and Native, who don't have that buying potential. And then on the land use side, I think if to flip it, it's like what might we do? Because it's not only about giving someone the purchasing power to go get their apartment. Because again, if we give them that, other people will figure out how to build that thing. Because that's the upside of capitalism, that people chase money. The other thing we do have to do is make sure the places that are available are the places those people want to move to, right? It's the voucher isn't enough. So if we had a land use conversation about what kind of places would people want to live in and what would that look like? I think that's the other side of density and other things where it's how do we allow people to stay where they are? What kind of places would they want to live in so that when those things get built, to target those buyers, like that can all happen. And in the meantime, I do think we'll probably have to have subsidies to carry over until that happens, because those things will take time. And we probably need some level of a voucher program or entitlement, because we have 400 years of disinvestment to catch up to. So we'll probably need something in the middle of that until the market recorrects.
Heather, last word. Can you maybe speak a little bit just forward looking in terms of how you position things in the Twin Cities?
Yeah, I can. I really think this is an exciting time for a number of reasons, primarily because people are more aware of the issue than I think they've been in certainly my career. I can remember working on like HUD 236 projects, back in the late 90s, and there was really not an understanding or awareness of affordability in our market. And I think we are starting to not just have the conversation about Section 8 vouchers. We're actually starting to have a conversation about affordability and deep affordability. And one of the ways I know that is by watching my neighborhood Facebook page, which is, I live in the Hamlin Midway neighborhood, just off the Green Line, light rail. And this area is starting to redevelop in really important ways and adding density along that light rail line. And what I see my neighbors saying more often than not is that they're really disappointed that there isn't more affordability being built into these projects, that they're primarily market rate projects. At the same time, I think it's important to realize that there needs to be a balance in a market between the market rate and the affordability. And I think the other thing that we learned in the early 2000s was that we didn't want to build projects where we had just market rate or just affordable. And so in the Twin Cities, we're starting to come into a more maturity kind of place in terms of how we think about housing and building housing. One of the things that I think is really exciting, though, is here in Minnesota, we have several modular developers. And I know in the West Coast, you guys have been doing this for a long time. We haven't here yet. We have two projects. One is almost done or done, and the other is in construction. And what's exciting about the modular piece is that those companies are providing jobs in greater Minnesota, good paying construction jobs, and they're providing housing in the Twin Cities that is, from a construction standpoint, a lot more efficient to build in terms of the actual construction timeline, but it's also cheaper to build. And so those are things that are really helping us move the needle on building more affordability. And I think the added benefit is that those modular units go in a couple of weeks on site rather than a construction site being active for like 6 to 9 months. So from a sort of infill development standpoint, there's some big advantages of modular construction. The other thing that I think is exciting is that even though this is a time of great disagreement and conflict in terms of public policy, I feel like more and more people are engaged around this issue and see it as very much an issue of values and an issue of public safety. And I think that's an exciting trend in this conversation, that we're actually treating this as an issue that impacts our communities in many different ways and not just on an individual basis. So I think we're moving in the right direction. We have a lot of work to do, and I'm excited to continue the conversation.
Well, Chris, Heather, so much for your time. For those of you who want to continue the conversation, we are going to be in the, I think, the number 7 breakout room called Homelessness and Affordable Housing.
Lucky 7.
Thank you both.
Thank you. Bye.
All right. Well, thank you so much, Greg, Chris, and Heather, for sharing your insights. And of course, the amazing D'Artagnan, Amanda, and Mark from the previous panel. I want to thank you all for the amazing work that you're doing in your communities, and so appreciate you being here today. And so that brings us to the end of our plenary presentations. I'm gonna give the final word to Daniel Zavala as the leader of Building Changes. But before I do, on a personal note, I just wanted to say a few thank yous. First of all, to all of our incredible speakers today for taking time out to share your insights with us all. I also want to give a huge shout out to the small army of folks who have spent the last few months working tirelessly and creatively to pull today's convening together. And there are way too many people to recognize individually, but I do want to give a shout out in particular to the folks at GMMB, Opus Digital, Durfner and Sons, and my colleagues at Westat, Building Changes, and the Gates Foundation, because none of this work would have been possible without you. And lastly, I want to recognize the incredible work that all of you out there in the virtual audience have done. It's kind of frustrating having to do this in a virtual setting and not being able to see all of you, but I really want to thank you for all of the work that you continue to do to end homelessness. I know that this can be frustrating work at times. Reflecting back on the 12 years that I spent working on this initiative, there were plenty of nights when I went home wondering whether I'd made any difference at all in the world. And thinking back, when I started at the foundation, George Bush was still president. My oldest son was 7 years old, and now he's a college freshman and taller than I am. And so when you think about that amount of time passing, it can be disconcerting to look around and to see that the problem still exists and it seems worse than ever. But what I hope this convening has shown is that as bad as the problem seems, our work together has most definitely made a difference. There are many more people moving into permanent housing today than a decade ago, and we just have to keep on innovating and improving. I love what Amanda said earlier about the need to reimagine the future in radical ways and to really tackle the hard upstream root causes of homelessness, systemic racism, poverty, and affordable housing. But I'm convinced that if we do that in the next decade, with the same focus and determination and smarts that we brought to our work over this past decade, but with even more urgency and conviction, that we absolutely can win this battle against homelessness. And I'm committed to being a part of the work moving forward, and I really look forward to continuing the journey with all of you into the future. So thank you for being here with us today. Daniel, over to you.
Thank you, Colin. I also want to thank the Gates Foundation for providing this platform today that so many of us have been able to use to share much of what we've learned, and also want to just echo the appreciation for all of the partners that are here today ready to learn and, importantly, turn this knowledge into action. As Colin referenced, and as we've heard throughout the day thus far, great work was accomplished in the last decade. However, we know that this is still not enough to address the growing inflow, continued racism, and racial discrimination, and the ongoing effort to ensure systems are aligning to meet personal need. And that's it. We know better now. And with this knowledge, our work must be different. We know collaboration is key, or as Mark Sussman put it at the start of today, the key is collective will. The next decade provides us with both challenges and opportunities. Our collective success will be defined by how we transform challenges and barriers into opportunities and positive impact. I'll highlight 3 opportunities stemming from today's conversations. First, we have the opportunity to amplify what has worked before. Many of the panels and breakout sessions today just scratch the surface of what we've learned. Second, we have the opportunity to work differently as a community, bringing government, providers, philanthropy, and business together alongside people most impacted by the work we do, namely people experiencing homelessness. Our work ahead must center people and their experiences with homelessness. Third, we also have the opportunity to rethink how we prioritize and allocate services, ensuring our approach does not perpetuate harm and discrimination. We must ask ourselves what it would look like to transform our eligibility and prioritization processes, the first point of contact for many people experiencing homelessness, to be more racially just. At Building Changes, our work over the next decade will be focused on these priorities. Through partnership, we identify promising strategies and advocate for change to those empowered to make funding and policy decisions. As I mentioned before, today we have just scratched the surface of showcasing our learning and what opportunities lay ahead to transform our equitable responses to homelessness. We welcome each of you to connect with us and learn more. Before we head to breakouts, I just want to ask one question of each of you. What is something you, personally, will take away from today's convening to build communities where people thrive in safe, stable housing with equitable access and use of services? The focus here is action. It is not enough for us to sit here and soak in knowledge. That alone will not change outcomes for people experiencing homelessness. So transform this knowledge into something you will do differently as a result of what you've learned. Start with singular action. So once more, I ask, what is something you, personally, will take away from today's convening to build communities where people thrive in safe, stable housing with equitable access and use of services? Again, thank you in advance for your work and your partnership. And now I'll pass it back to Colin to preview the breakout sessions.
All right, well, thanks so much, Daniel. And now comes the fun part, which are the breakout sessions. I know that all of you out there have been dying to come off mute and to turn on your cameras and to really engage with our speakers. And now is going to be your chance to do so. So what you should be seeing on your screen right now is the list of the breakout sessions in the topic and a button that says join a breakout room. And so if you go ahead and click on that join a breakout room, you'll be able to see a list of all of the breakout sessions, and you can go ahead, just as many of you are now, and click join on the session that you would like to join. And as you do that, you'll start seeing the people who are joining the session that you are in as well. And so go ahead, and all of the rooms are now open and are operating. So please go ahead and join your breakout session. And remember, you'll have a chance to join 2 sessions. We're going to run these twice. So choose the first one that you want to join into, and you'll have a chance to join in the next one after the first one is over. And once you're in your session, you can go ahead and your facilitators will get you started. All right, everybody, it looks like we're slowly getting everybody back from the first breakout session. I had a chance to kind of hop around to the sessions, and I think I one for a little bit, and wow, really saw some amazing conversations going on. So I hope that you got a lot out of the ability to finally have some conversations with folks and to have questions and answers, and really saw some great conversations going on. So I think now we are in the home stretch. This is your second breakout session, so you can choose a different one. If you really liked your first one, you want to keep that conversation going, feel free to join the same one. And I just also wanted to remind folks that there won't be any reconvening back in the plenary session. So once you're done with your second breakout, we want to thank you very much for being a part of this convening. Also wanted to let you all know that the entire day has been recorded. It's going to take us a little while to get it up onto the Gates Foundation Family Homelessness website, but we will be doing that. And you can tell your colleagues who weren't able to make it today that they can kind of relive the day if they'd like by going to that website and checking out that recording.